she'll join.
Once I have a full slate of panelists, I'm actually just going to get started to respect their time. So let me just see. All right, I think we just missing one. Let me just go through this really quick. Okay, so we're going to go ahead and begin. Let me just start now. My name is Ricardo Arroyo. I'm the District 5 City Councilor. I'm the chair of the Boston City Council Committee on Public Health. I'm joined by my colleagues, Councilor Ed Flynn, Councilor Kim Janey, Councilor Liz Braden, Councilor Anissa Savi-George, and I believe that's it for now. We have one other councilor, Councilor Bach, who's a co-sponsor on this. She's in another meeting. She'll be joining us momentarily. She apologizes for her tardiness, but can be avoided. This hearing is being recorded and live streamed at boston.gov City Council TV. It will be rebroadcast on Comcast Channel 8, RCN Channel 82, Verizon Channel 1964. The Zoom link to provide public testimony for this hearing can be found by emailing Shane Pack, that's SHANE.PAC@boston.gov. Please make sure that your Zoom handle is your full name. When you are called, please state your name and affiliation/residence and limit your comments to 2 minutes to ensure that all comments and concerns can be heard. If you are unable to provide testimony today, you may submit written testimony emailing the committee at ccc.health@boston.gov or filling out the form on our website within 48 hours of following the hearing. Today's hearing is on Docket 0747, which is an order for a hearing regarding the status of college and university plans to reopen for fall 2020 amid the COVID-19 pandemic. This is the second meeting. We had a prior hearing on this prior to their reopening, and now that they've reopened, we're being joined again to go over that. I just want to note that Councilor Campbell has joined us. What we're going to do here is, if you were at the last hearing, it was a 5-hour-long hearing. It was incredibly long, and thank you so much to, I know BU and Harvard, Mark Hanley and Mr. Ryan both stayed until the very end of that to answer questions. We're going to do it a little different this time. My hope is that it increases both the speed and efficiency of this. And so what we're going to do is I'm going to allow every panelist to give an opening statement immediately. And then we will break the question and answer session into panels. So in other words, every panelist who is here to speak, I'm going to give you 3 minutes to give an opening. And then we will open it up to the panels. The way we would have done it last hearing was every college basically had a panel. We'll still panel the questions. So you can ask, so basically we'll say this is for the administration, this is for Northeastern, this is for BU. You could still do it that way, but the opening statements, everybody's going to be able to do that immediately. And we have been told of some time constraints. And so in that instance, we'll handle that immediately as well. At this time, I want to give the floor over to the lead sponsors of this ordinance, not this ordinance, of this hearing order. That's Councillor Braden, Councillor Janey, and if Councillor Bach gets here in the midst of that, she'll also be able to go. But at this time, I'd like to give Councillor Braden the floor for a few opening statements.
Thank you, Mr. Chair, Councillor Arroyo. I welcome the opportunity to meet or hear what the representatives from their different universities have in terms of an update on their status of their COVID preparations, how successful they have been, any pitfalls or challenges that they've encountered, and also maybe some plans going forward. As you may imagine, this is a very important issue in my neighborhood, my district, District 9. We have Harvard University, BU students and Boston College students, residents in our neighborhood. And it's of great concern to our residents that we continue to be very diligent in observing public health recommendations and restricting the spread of this virus as far as possible. So I look forward to the conversation. Thank you.
Thank you very much, Councillor Braden. Councillor Janey, if you have any opening statements.
Yes, thank you so much, Mr. Chairman. I just want to extend my gratitude to you as well as my co-sponsors on this, my sisters in service, Councillor Braden and Councillor Bach. I want to thank the administration, want to thank the colleges and universities who were present last time, as well as those who are joining again or for the first time today. Very important conversation to have. So I'm really glad that we are continuing the conversation as students have now returned. Since then, we have seen in today's paper, there's a headline about Harvard students being sent home for today on boston.com or bostonglobe.com. And before that, we saw with Northeastern. Like Councillor Braden and Councillor Bach, my district has a lot of college students because of the universities there. We have Wentworth, we have Roxbury Community College. Northeastern is probably the largest institution in my district. And this isn't just about the safety of students and the safety of staff. We certainly care deeply about that, but it is a larger community and the impact on the larger community. So I'm grateful for the opportunity to continue this important conversation. Thank you, Mr. Chair.
Thank you. And so here's for folks that just joined us on the council side, I'd like to acknowledge that we've been joined by Councillor Wu as well as Councillor Mejia. And so here's how we're going to do this next portion. I'm going to introduce all of our speakers and allow them to go in order of introduction. I'll just say it's your turn. We're going to give you 3 minutes. I will cut you off at 5. So you have a little bit of wiggle room, but you have 3 minutes, but you will get cut off at 5. And then we'll go into questions for Mark Hanley. Those questions will begin first because I know that he has time restraints. As far as my fellow colleagues on the council, if you have an opening statement and you can't stay and you need to jump in at some point to make, or just a statement that you would like to make, raise your blue hand, but I'd like to try and keep this economical. So if you can save that for your question portion, that would be great. But if you have to leave to something else, just raise your blue hand. Once I see it, I'll make you the next speaker. So thank you for that. So now with no further ado, I'd like to introduce, if I can, I see Councillor Flynn with his hand up. So Councillor Flynn, the floor is yours.
Thank you, Council Royal, and to the sponsors. I just want to say thank you to the college and university officials that are here. I also have several colleges in my district, and it's critical that the colleges and universities continue to work with the residents of that neighborhood to make sure that the students that are living there are behaving themselves and not having these super spreading events that we have seen across the country. So again, I know we have a very dedicated and professional group of college administrators that are here, and they're also concerned about the health of the residents of Boston. So I want to say thank you. I also see Dr. Lowe from the Public Health Commission that does a tremendous job as well. So no questions for me, but thank you, Councilor Arroyo, and thank you to the sponsors.
Thank you, Councillor Flynn. And so with that, we have with us today Dr. Jen Lowe, the Medical Director at the Boston Public Health Commission, Mr. Tom Lane, the Boston Public Health Commission, Nupur Monani, is that the correct pronunciation? Yes?
Yes, that's correct. Thank you.
Oh, fantastic. Senior Institutional Planner at the BPDA. We're joined by Mark Hanley, the Director of Government Affairs and Community Relations from Harvard University. Mr. Ken Ryan, the Director of City Relations, Government and Community Affairs at Boston University. John Tobin, the Vice President of City and Community Affairs at Northeastern. Thomas Keaty Jr., the Vice President of Governmental and Community Affairs at Boston College. And Jean Levesque, the Director of Government Relations at Boston College. And so we're going to go ahead and start with, normally we start with the administration, but due to time constraints, I'm going to start with Mr. Hanley, the Director of Government Affairs and Community Relations at Harvard University.
Thank you so much, Chairman Arroyo, and thank you to the sponsors of the hearing order, including my district city councilor, Councilor Breeden, and Councilor Bach, who also co-sponsored, and of course, Council President Janey, and everyone else who is here today for this reconvened hearing. I appreciate the opportunity to provide, again, the council an update with Harvard's fall semester to discuss our lessons learned and our planning considerations for the upcoming spring semester. Throughout the COVID pandemic, Harvard has been guided by a consistent core set of principles. First among them has been prioritizing the health and safety of students, faculty, staff, and residents, and ensuring that Harvard's academic mission, teaching, learning, and research, continue at the highest levels. Throughout the fall semester, the vast majority of learning and instruction at Harvard University is taking place remotely, online, with only limited exceptions across all of Harvard schools. Less than 25% of Harvard College undergraduates have returned to campus, and they're living in de-densified dormitories on the Cambridge campus, mostly consisting of first-year students, as well as undergraduate students who are unable to successfully learn remotely from their homes. All students who returned to campus completed a COVID-19 training and the Massachusetts travel form prior to their return. All students returning underwent initial baseline testing immediately and completed an initial required isolation period until registering 2 negative COVID tests. Students living on campus have agreed to abide by a residential community compact, which provides guidelines for social distancing, hygiene, gathering limits, and other community standards, and they must complete daily symptom attestation through the Harvard Crimson Clear system. Students and staff on campus undergo testing with a recurring schedule in place. Harvard University Health Services has developed a robust contact tracing program. And as of today, almost 23,000 tests have been completed on the undergraduate population, and 9 positive cases of COVID have been identified. This testing has been extended to off-campus Harvard College students in proximate communities. And for the full testing data across all of Harvard University, including almost 90,000 tests so far, please visit our university dashboard at harvard.edu/coronavirus, and it is updated daily. As we begin to consider what our campus will look like in the spring, we know that our planning approach needs to continue to be nimble to allow for us to respond to ongoing changes in real time. We're always working to thoughtfully adopt protocols and plans that can be flexible and assist us as we plan for the unknown throughout this unprecedented time. As the fall semester comes to an end, the majority of students currently on campus will depart campus for Thanksgiving break, and the majority will not return for the remainder of the calendar year. Our approach to the spring semester was originally laid out in July. We outlined 3 potential scenarios, accounting for a lower, a moderate, and a higher density students on campus this spring. We anticipate a decision to be made regarding the spring semester in December, and any decision will be guided by COVID-19 infection trends and guidelines to come. Throughout the rapidly changing public health landscape, the university has continued to work closely with the City of Boston the state and peer institutions to support decision-making and provide resources. We are thankful for these ongoing collaborative relationships. And it was these early collaborative research sector advocacy conversations that shed light on the importance and the urgency of resuming on-campus research this past spring. The Massachusetts research sector is critical in our local economy, and it accounts for $6 billion of yearly economic activity, $4 billion of which takes place within the nonprofit research university setting. Tens of thousands of Massachusetts residents work in Boston research labs. Understanding the significance of on-campus research, Mayor Walsh led coordination efforts with local colleges and university presidents. And the early opportunity to resume on-campus research rose to the top of the list as an impactful and safe sector of work to resume on a limited basis. We were excited by this successful early return of de-densified research activities as a result of city and state guidance. Continuing the pace of research at Harvard University, an activity which in large part takes place in safe, controlled laboratory environments with staff trained in avoiding contamination and using proper PPE, was an important step in phase 1 of reopening and a true success. Keeping up the pace of university research, not just related to COVID research, data science, and analysis related to infectious disease, but also the full range of laboratory and medical research that has contributed for hundreds of years to the health and quality of human life, remains a top mission-based priority for Harvard University. Despite the uncertainties ahead and throughout this time, these efforts of collaboration and vigilance, will continue to be critical in the weeks and months ahead. I hope that Harvard's demonstrated commitment to public health in our host communities and our academic mission provides confidence in how we'll move forward. Thank you, Chairman Arroyo. Thank you, Councilor Breeden.
Thank you so much. And I'm going to allow, in the case of Mr. Hanley, if you have a question specifically for him right now, if you could raise your blue hand, I'll go right to you. Otherwise, we'll go as long as you can stay on, Mr. Hanley, but we'll put you in that first panel of questions. Seeing no blue hands, I'm going to go to the next speaker, and if that's that would be Dr. Jen Loaf, the medical director at the Boston Public Health Commission. You have 3 minutes, 5 if you really want.
Good afternoon, Chairman Arroyo and members of the council. My name is Dr. Jennifer Lowe, and I'm the medical director of the Boston Public Health Commission. I want to thank you all for bringing us back together today on this important topic. I just want to begin with the numbers first. As you know, the COVID-19 pandemic has had profound impacts on the city of Boston. As of October 2nd, Boston has had 14,427 confirmed cases, with 14,529 recovered and 764 deaths. As we continue to approach the response and recovery to this pandemic with an equity lens, it is important that we acknowledge that it has disproportionately impacted communities of color and other vulnerable populations. Excuse me. As of October 2nd, the rate of reported cases among Black residents is 319.2 per 10,000. The rate among Latinx residents is 368.9 per 10,000. Compare this to the rate of reported cases among white residents, which stands at 133.5 per 10,000. Also, as of October 2nd, the rate of reported mortality among Black residents is 172.8 per 100,000. The rate among Latinx residents is 66.8 per 100,000. And the rate of reported cases among white residents is 112.0 per 100,000. We have been keeping a particularly careful watch on cases related to our colleges and universities. Approximately 50,000 university students have returned to Boston since August 1st. Since that date, we have had approximately 3,200 cases reported citywide, and of these, less than 400 cases are of staff, vendors, and students of colleges and universities. Since the last time the council held a hearing in July to discuss this topic, we have been busy working with these institutions to review their plans and ensure adequate infection controls. Over the summer, we asked colleges and universities to share with us a copy of their COVID-19 higher education control plan, the template required by the State Department of Public Health to demonstrate alignment with state guidance. As part of the control plan, we requested a description of plans for quarantine of off and on campus students and a description of testing and tracing protocols. For testing, we set the expectation that all students, faculty, and staff on campus be tested, along with any contractors that are on campus for any extended period of time. We met individually with each college to review, recommending minor changes to some, and for others, asking that they redraft and submit a new plan. Since then, we have been holding weekly calls with the colleges to continue to work on implementation of these control plans and ensure that they are adhering to state guidance. This has been a cross-departmental effort with BPDA, ISD, and the mayor's office participating for a comprehensive discussion of all related issues. We would like to thank the colleges and universities for their responsiveness and partnership in these efforts. For contact tracing, most institutions in Boston have adopted a suggested model from the state with shared responsibility between the institution and the local public health department, BPHC. Most colleges act as the ordering provider for the test, so they receive the results first. The institution immediately notifies BPHC and begins the isolation and quarantine process. From there, either BPHC or the state's Community Tracing Collaborative will support their efforts with contact tracing and next steps. Regardless of the model, BPHC is always made aware of the results immediately and supports the college in taking swift and appropriate action. This has been working out well to date. We would like to publicly share our appreciation for the many colleges and university staff working on this, as well as our own dedicated and talented staff at BPHC. I want to emphasize that mask wearing and physical distancing are the key to preventing future transmission, especially in a college and university setting. We applaud the creative communication efforts from many of the colleges to share that message with their campus communities. I also want to acknowledge the issue of parties and gatherings and off-campus housing across the city. We encourage residents to call the BPD party line at 617-343-5500 to report any large parties taking place in the city. We appreciate the work of universities to reduce the number of gatherings and encourage students to avoid these events during this time. In closing, I would like to thank the Committee on Public Health for allowing me the opportunity to testify. We're looking forward to hearing more from the colleges and universities that are here today. I'm happy to answer any questions from the committee. I just want to point out that Tom Lane will not be speaking next. I am the representative from BPHC. So thank you very much for your time.
Thank you for that. Nupur Manani from the BPDA, if you want to take your 3 to 5 minutes now.
Thank you, Chairman. Good afternoon, Chairman Arroyo and members of the Council. My name is Nupur Monani, and I'm a Senior Institutional Planner at the BPDA. Thank you to Councillors Braden, Janey, and Bach for sponsoring today's hearing. I'm testifying to share updates in relation to the BPDA policy, which was announced the last time we gathered on July 9th, to help institutions wishing to de-densify their campuses for the fall 2020 semester. As of last week, 9 colleges and universities are using hotels or apartments for housing, dining, learning, and quarantine and isolation related functions, in line with this policy. The BPDA, ISD, and Licensing Board have been jointly reviewing details related to use, move-in, operations, and management for each location as the applications trickled in. As the applications came in, we also saw that hotels and apartments that institutions were proposing to partner with were scattered quite widely throughout the city, including many in neighborhoods that may not be used to seeing an increased activity around the fall. And so we flagged the need for proactive communication from the beginning and insisted that all institutions reach out to local civic associations as we reviewed these plans. Institutions following our guidance met with their respective task forces, neighborhood groups, and many of you before receiving approvals from our respective agencies to proceed with inspections and move-in. At the same time, we at the BPDA have also been working to make these applications, locations, and other details available on the website through an easy to follow and interactive map that is being continually updated as and when any adjustments are made on the ground or any of these plans change in response to the changing reality. Based on the feedback received to date, the community has been largely supportive of these plans. Some have shared concerns related to ongoing operations and management. Civic groups have also asked for a direct line of communication in order to report non-compliance or unsafe behavior directly to the institutions. And so in response to these concerns, we have established 2 critical actions to maintain continued oversight of this policy and its impacts. Starting September 7, as the semester began, the interdepartmental working group led by the Boston Public Health Commission, as Dr. Lowe was just alluding to, in partnership with the mayor's office, including all of the agencies involved in this work, have been hosting a weekly call with all of the colleges and universities to exchange updates and anticipate any oncoming challenges. I'd like to thank the universities and colleges for their continued collaboration and active participation in these calls. The second action is that each university using off-campus spaces, the 9 that I mentioned earlier, has been asked by the BPDA to host weekly office hours throughout the semester to address any issues that stem from the community's perspective and address them in real time. Looking ahead to the next few weeks, the interdepartmental working group will be meeting to think through our approach toward off-campus de-densification for the spring semester. We will review the process and results to date and make any adjustments as necessary to ensure that we are prepared to respond in a safe and timely manner to the persisting risks posed by COVID-19. We will continue to use the BPDA website and the weekly college call, along with other open channels of communication, to make any updates available as and when they get agreed upon. Thank you again to Chair Arroyo and the sponsoring counselors for reconvening this group to talk through the issue. I'm happy to take any questions and look forward to hearing from all of the other panelists. Thank you.
Thank you. We're making good time here. So just for the panelists, Ken Ryan is next. He's the Director of City Relations and Government and Community Affairs at Boston University, followed by John Tobin, the Vice President of City and Community Affairs at Northeastern, followed by Thomas Keaty Jr., the Vice President of Governmental and Community Affairs at Boston College, followed by Jean Levesque. And then we'll go into our first panel of questions, which will be the administration plus Mark Hanley. And I'd just like to note that we've been joined by Councilor O'Malley as well for this hearing. And just so that everybody's up to date again, we're going to have all the speakers speak 3 to 5 minutes to try and make sure nobody's waiting for hours like last time. And then we'll go into panels of questions. The first panel will be administration and Mark Hanley, followed by, so that's BPDA, that's the Boston Public Health Commission, followed by all of the colleges as a whole. And then we'll do as many rounds as it takes. And so with that, Mr. Ryan, the floor is yours.
Thank you, Mr. Chairman. And thank you, Council President Janey and Councilors Bach and Braden for sponsoring these hearings. For the record, my name is Ken Ryan. I'm a lifelong resident of South Boston, and I work at Boston University in the Office of Government and Community Affairs. For the Q&A portion, I will be joined by Dr. Gloria Waters, Vice President and Associate Provost for Research, and Ken Elmore, Associate Provost and Dean of Students here at Boston University. Since our last hearing in July, Boston University has dedicated every possible minute and resource to continue its mission of education, research, and service with the highest degree of safety and well-being that we can possibly achieve for our communities. Thanks to the tireless work of our dedicated staff and faculty throughout the summer, we've launched our new hybrid learning teaching format, Learn from Anywhere, while transforming our physical spaces to minimize risk and to optimize campus life in a socially distant environment. We've reshaped the landscape of public health through our required practices for physical distancing, face covering, and hygiene, which are highly visible in our signage and daily communications. And through the build out of our nationally recognized BU Clinical Testing Lab and public-facing BU COVID-19 testing data dashboard, we've developed one of the most comprehensive and transparent testing and contact tracing systems in the country. The measure of success, though, is in the numbers. Since its opening on July 27th, the BU Clinical Testing Lab has conducted close to 193,000 tests, averaging 4,300 tests daily. Just this past week, close to 16,000 students were tested, along with 5,100 faculty and staff. As of October 4th, the university has a cumulative negative test rate of 99.93% and a cumulative positive rate of 0.07%. But as President Brown wrote to our community at the beginning of the fall semester, the most important change, one that is less physically evident, but absolutely critical, is in what each of us does to ensure that we succeed in protecting our community and each other. To keep the virus at bay, he has pointed to 3 things the Boston University community must do. 1, we must adhere to the testing and daily symptom reporting processes. 2, we must adhere to the protocols for face coverings and physical distancing at all gatherings, both off campus and on campus. And 3, we must follow these protocols outside of the university in our day-to-day life here on campus. Attending parties or gatherings without practicing physical distancing or wearing face coverings is behavior that endangers our academic community and our neighboring communities. To hold students accountable, a blunt warning has been issued. If you host or attend a large off-campus or on-campus gathering, social, or party, you will face suspension from Boston University. With the fall semester underway, the university is now actively planning for the winter and spring 2021 semester. In accordance with current public health recommendations, we are strongly encouraging students who wish to complete the fall semester on campus to remain here over the Thanksgiving break. Students who decide to travel outside of Massachusetts will be subject to public health regulations, which, depending on their destination, could require quarantine for up to 14 days. If students make the decision to travel home for the holiday, BU will recommend not returning to campus and instead completing the semester remotely under the LFA model. For the spring semester, our overarching goal is to continue with the elements of our Back to BU plan that have been working while incorporating improvements based on experiences during the fall semester. The university plans to continue with its Learn from Anywhere hybrid model during the spring to offer students the option to learn remotely if they are unable to be on campus in person. The university has also announced 2 changes to the spring academic calendar. 1, spring classes will begin on Monday, January 25th, 2021, rather than Tuesday, January 19th. And 2, there will be no spring break recess this academic year. These adjustments are designed to reduce our community's risk of exposure to COVID-19 by limiting the amount of travel occurring within the semester. Students living on campus have also been told to plan for an extended scheduled return in January, with reserved arrival dates and times required, similar to our successful move-in operation in August. Thanks to those who learn, teach, and work on our campuses each and every day, as well as our close coordination with the Walsh administration, the Boston City Council, and the City of Boston, we are demonstrating that providing world-class residential education and best-in-class public health and safety are not mutually exclusive. In fact, done well, they make each other possible in this COVID-19 world. Thank you very much, Mr. Chairman.
Thank you, and I appreciate everybody sticking to time so far. The floor is now former Councilor John Tobin, current Vice President of City and Community Affairs at Northeastern. You have 3 to 5 minutes, depending on how much you want to use.
Thank you, Chairman Arroyo. I appreciate it. And to you, thank you, through you, thank you to the makers, Councilor Braden, Council President Janney, and Councilor Bach, and to your other colleagues who are here on the call. We appreciate you continuing this conversation because we think it's through communication and through action that we all work together to make sure that we're all successful, not just on our campuses, but also with our neighbors and community as well. I will also be joined in the question and answer portion of the panel when it comes time for questions by Kathy Spiegelman, my colleague Kathy Spiegelman, who's VP of Campus Planning, Chief of Campus Planning at Northeastern, and also our Senior Vice Provost for Research, David Lezzi. They were both on the call on the last hearing that we have continued this evening. When President Allen made a decision to move Northeastern forward and to bring students, faculty, and staff back to campus, we knew it was with a great weight of responsibility that we had, not just to our community members on our community, but also to our neighbors surrounding us in the city of Boston. To that effect, much effort was made on de-densifying our campus. much has been made about hotels. Newport talked earlier about the hotels that are being used. Northeastern is using 2 of them, the Midtown Hotel and also the Westin at Copley. And to that end, there was a great process that was set out by the City of Boston, by the BPDA, licensing, ISD, but also with the neighbors and the neighborhood associations. We work very closely with the neighborhood associations that surround both those hotels, doing Zoom calls, being in constant communication through that licensing process, which continues moving forward right now. Testing, it's only going to be successful if there's frequent testing, and it's done diligently. To this, as of today, just before we get on this call, there have been just over 200,000 tests conducted by Northeastern University with a positive rate of 0.05%. There is constant contact with the Public Health Commission and with the Mayor's office. There's constant contact through emails, through newspaper ads, phone calls, but also using social media with students, with community, with neighborhood associations, like I said, and with elected officials, many of whom are on this call right now. We've also set up it's not just on campus, but we're also very concerned about, off-campus gatherings, as many of my peers have talked about here prior, and councils have expressed a concern with. To that end, Northeastern has established a tip line to report all off-campus student behavior, help take the stress off of 911 and 311 calls. And we monitor that 24 hours a day, 7 days a week. That number is 617-373-TIPS. And that's just not tips just on for residents to use. Our own students use it as well. There's a mandatory overtime police car that monitors Mission Hill in Roxbury, in the Boston police car that has college representation there. Not the communication amongst the colleges and the universities throughout this pandemic has been terrific. And I want to point out many of my peers who are on this call now, but in Mission Hill, we work very closely with our peers at Wentworth and the in the College of Pharmacy. We have representatives and CSOs up there with Boston Police, and as well as civilians who will monitor Mission Hill and monitor the Fenway in Roxbury, looking out for large gatherings, giving warnings and adjudicating matters and bringing students in for warnings and for conversations that warrant that. And that conversation takes place with Masco, which oversees that program. We do weekly meetings with the administration every Thursday, and like I said, with other universities. We're working very closely with, like I said, a number of neighborhood associations, not just in communication and policy, but signage in the neighborhoods, reminding people on safe protocols, including on Carter Playground, which is a city-owned playground that Northeastern did over. And we have signage there as well, and trying to remind people and really use peer-to-peer in good modeling behavior, and having students talking to students. We find that to be much more effective way to do things. And then we hired ambassadors to deal with community rather than putting students into those situations. At Matthews Arena, our de-densification efforts on our campus allowed us a space to conduct 4 blood drives with the Red Cross at Matthews Arena thus far. And also we held the primary election at Matthews Arena for 4 precincts in Fenway. And those 4 precincts will again vote at Matthews Arena in the general election. We're assisting with cleaning for neighborhood streets during and move in and afterwards, and working on different community projects to the extent that we can, following great good social distancing guidelines. We've donated PPE supplies to Drive Boston, the Fenway Community Center. And as regards to the spring updates, we have a plan in place. We're getting ready to share that with our students. And as soon as that is, we want to share with our students first. And as soon as that is shared with our students, we will, of course, transmit that not just to our elected officials, community groups, our task force members, and our community advisory board members. We will spread that out there in due time. So I look forward to other folks' testimony into questions that arise during the course of this hearing. Thank you, Chairman Arroyo.
Thank you. And I believe I made both you and Mr. Ryan represented that some of the folks that were attendees would also be answering questions. I believe I made them panelists. If they haven't been made panelists, just let me know. That goes for anybody else who has perhaps a colleague who's waiting out there. With that, and thank you, Mr. Tobin. Thomas Keevy Jr., the Vice President of Governmental and Community Affairs at Boston College. The floor is yours. And then we just have Jean Levesque. I believe that's how that's pronounced, so hopefully I'm not hurting the name pronunciation there, who's the Director of Government Relations at Boston College. So if you want to go together or you want to go one after the other, that's fine.
Counselor, I'll be speaking in the opening statement. Both Jean and I are going to be working together throughout this hearing. Before I begin, I'd like to just thank you and the members of the City Council, also the members of the Mayor's Administration, the Boston Public Health Commission, the Boston PDA, BPDA, the Boston Fire, ISD, and all the various agencies that we have worked to make our reopening at Boston College a reality. All of my colleagues have spoken from the various institutions that are part of this discussion today. And we too, along with them, have used the same guiding principles on reopening. When Boston College closed in mid-March, President Leahy called for a committee to begin the process of looking at reopening. The first was the summer classes went online. We did not have any in-person summer classes. We made that decision in early April, but we started to meet and to consider the reopening and move in for fall reopening. The guiding principles were absolutely number one, the health and safety, well-being of our community is paramount in our decision-making process. Our decisions regarding the fall semester are informed by medical professionals and guidance issued from local, state, and federal public health authorities, in particularly, excuse me, the Boston Public Health Commission. Given the ever-evolving nature of the pandemic, our plans have remained flexible, and we have changed, especially during the month of September, with off-campus students. And if they were tested positive, originally they were going to be going back to their apartments, and we made a change to house any students that tested positive that were living off campus. I think that was a good decision. And we were also committed to providing regular communication and updates with all members of the BC community and our neighboring community as information becomes available. We have a website that is updated daily, and we have been very transparent in reporting our cases. As of since mid-August through today, we've done 44,687 tests. Currently, we have 43 undergrads who are in isolation. 134 have recovered. Out of that 134, 131 undergrads. And we are located in 4 communities: the city of Boston, the city of Newton, the town of Brookline, and the town of Dover. We have 1 hotel located in Boston on 40 Mount Hood Road. We also have, as many of you know, we acquired Pine Manor College, which brought us an additional 500 beds. And we also have a retreat center in Dover, Massachusetts, that has approximately 63 beds. We work very hard every day. As I tell my staff, we're only good as our last weekend. Off campus, we've had a very quiet fall. Our football team is currently 2-1, but we have had no fans allowed into Alumni Stadium, and no fans were allowed in for any of the other fall sports as well. I'm more than happy to take any questions or comments as we proceed through this hearing today.
Thank you, Mr. Keaty. So with that, I believe that is all of our speakers. And so now we're going to go into our question and answer session will be by order of appearance. The lead sponsors will be going first. I will be going last. The first round will be the administration. So for folks who may have missed just that part, that is Dr. Jen Lowe, who is the Medical Director for the Public Health Commission. That is Nupur Monani, who is the Senior Institutional Planner at the BPDA. And that is, we're going to add Mark Hanley, who's the Director of Government Affairs and Community Relations to that first panel because he has a hard stop. And I believe that's everybody. If anybody I left off was going to be answering questions in for Boston Public Health Commission or BPDA, is that everybody who's here? I know we had, okay, perfect. And so with that, I'm going to go to Councilor Braden. For my colleagues, I'm hoping we can keep each round of questions to 5 minutes per person. When we hit 5, I'm just going to put a 5, like looks like stop, because it is. That means we've hit 5 minutes. And my hope is that you do stop. If you don't, and my hand gets tired, I will tell you to stop. And so basically you're playing a gamble with how long it takes for my hand to get tired. And so with that, Councilor Braden, you have 5 minutes, and we'll do as many rounds as it takes. But for the first round, it's the administration and Harvard. For the second round, it will be all of the universities at once, and you can direct your question specifically to the university that you have that question for, and we'll do as many rounds as it takes. So with that, Councilor Braden, the floor is yours.
Thank you, Mr. Chairman. This is a question, I think, Dr. Lowe, you mentioned that the BPD had a party line. Can you repeat the number for the party line to attend to off-campus parties or
Yes.
gatherings?
617-343-5500.
Thank you so much. I had an email from a resident over the weekend, and she called 311 and she didn't get any good action. Just out of interest, have there been many calls to the party line?
I'd have to get back to you on that information. I'm actually not sure.
Okay. And then there was a question for Nupur about meeting with the task forces and neighborhood groups. I was wondering, does Boston University have a representative from the Alston community on their task force?
Councillor Braden, I believe that they do. If I'm wrong, Tom or Jean can correct me.
Not Tom or Jean, not Boston College, Boston University.
I would have to double check and get back to you on that. I believe there should be some representation from that group on BU's task force.
Yeah, because there's a huge number of Boston University students. The bulk of the actual university buildings are probably in Councillor Bach's district, but a huge number of students actually live in Alston, and the Alston Civic Association hadn't been contacted about the plans for the fall reopening and off-campus housing, etc. So that was a concern. I think those were the only two questions I had for now. Thank you.
Thank you, Councilor Braden. That was certainly within the time limits. And also just a reminder that Mark Hanley from Harvard is also in this first panel.
Oh, yeah.
And so the order for folks who are here, Janie, President Janey will be next, followed by Councillor Flynn, if he's still present. I know Councillor Asabi George had to step out, she'll be back. So it would be her, then Councillor Campbell, then Councillor Wu, then Councillor Mejia, then Councillor O'Malley. So with that, President Janey, the floor is yours.
Thank you, Mr. Chairman, and I will be brief. My colleague has modeled really good behavior, so I'm going to try to follow her lead and keep my remarks brief. Just a couple of questions. So one, because we do have Harvard on the line, I was wondering if you could shed any more light to the incident that the paper is reporting. It's a repeat of what we saw, I think, a few weeks ago at Northeastern. That's one question. And Mr. Chair, I'm just going to get my questions out. So that's one question, if there was any update there. I am really interested in whether or not there are more conversations. So at the last hearing, we were having conversations about the hotels. Now clearly, you know, so Midtown is being used, the Westin's being used. Are we still in that process at looking at other hotels to see if we can take more students off their campuses and into hotels? Or are we pretty much there? So done with that. So that's another question. And then I am really interested in the overall monitoring and how the city, the administration is working with the universities and colleges just to make sure that different protocols are being adhered to. And when they're not, I wonder what happens. So that's another question. And then in terms of engagement, just on Councilor Braden's last point with the parties, this is an ongoing issue in my district. I'm grateful that there are the tip hotlines, and I will certainly share them out. But I wonder, I get constant complaints, and I don't mean to pick on any institution here, but given the district that I represent, many of the students, whether they're housed in kind of Mission Hill parts of Roxbury or Highland Park parts of Roxbury, all near the institution, we see, we get complaints of parties. And so I'd be interested in, I think the university has put out a pretty hard line, universities, as we see the story about Harvard and the 11 students, I think it was from Northeastern earlier. I'd just be interested in how we can do, what more can we do to keep those events where people are gathering and perhaps not being safe, being a little more risky with behavior, at parties, college parties and things like that. What more can we do to try to keep that down, not just for the sanity of residents who live in our communities, but really the health factor as well. Thank you, Mr. Chair.
Thank you. And we can take those questions in the order asked.
Council President Janey, you asked about Harvard students who were dismissed from campus. All Harvard undergraduates who were invited and agreed to live on campus in Cambridge, it's about 25% of our normal undergraduate population, were invited back. Most of them are first-year students or students who couldn't learn successfully at home. All of them agreed to abide by certain behavior, a campus compact. And a board was set up to enforce that compact. 3 students were dismissed from campus very recently, and that's been reported.
Councillor Jenny, you need to unmute. We can't hear you.
Thank you. So the other question just was around, are we done with the hotels in terms of, this might be more to BPDA? Are we still looking at other are we looking at other hotels to see if we can repurpose them? And then just wanted to talk more about the engagement with residents in our community and how we can have, and this is, I guess, a longer term conversation, because pre-COVID, when there was no necessarily big health crisis before us, I think there was still just tensions of how we all live together in community. So those are the last two, the community engagement piece and the hotel piece.
Thanks, Council President Janey. I'll take the first question first. At this point, we don't have any applications that are currently under review. The last of the 9 applications that came through to us came in early September, and we approved it along with ISD and licensing at some point 2 or 3 weeks out. So to the best of my knowledge, we are not anticipating any other applications coming through for the fall semester, also considering that the semester is underway at this point. Our focus over the next few weeks is going to be to look ahead to the spring and try to answer some of these questions as they pertain to January onward. And so what we'll be looking to do with the same set of people who are actively involved in this from the administration now is reflect on sort of how the process went, identify any issues, and then try to understand what we need to change, if anything, going forward into the spring. And at that point, I think once we know more about the university's plans for how they propose to conduct learning, we'll be able to answer the question of what do these hotels and sort of de-densified campuses look like in January. So short answer at this point, I don't anticipate there being any more locations considered for the fall. To your second question, Council President Janey, I would say that there's a couple of different ways in which any issues can be reported. One is the line that Dr. Lowe mentioned earlier. There's also 311. I know that we have been receiving sort of several complaints through 311. There's also the weekly calls that each of the institutions are hosting for the local residents and civic groups. So any issues that or non-compliance that may be observed during that time can be reported directly back to the institutions. And our hope is that through these sort of 3 or 4 different channels that have been sort of widely communicated to the communities at large, we can continue to stay on top of the situation as it evolves. Certainly going into the spring, you know, if there's any room for improvement in how we're conducting this process and how the options that folks on the ground have to reach out to either us or the universities, we'd be very happy to sort of consider and implement all of those options, because I think communication is key to maintaining the success of any of these plans going into the spring.
This is Jennifer Lowe. I can speak, well, specifically when issues arise, off-campus issues arise, and we're made aware of them, we work very closely with the institution to address any particular concerns or clusters or hotspots that might arise in a particular institution. And that will, again, we continue to partner with them very closely. They notify us. We have very good channels of communication with each of the universities. In addition, I wanted to go back to the data. We monitor the data very closely on a not just university and college level, but on a neighborhood level as well. So all of our efforts in engaging, we regularly reach out to neighborhoods where we're particularly concerned in terms of high positivity rates, and how can we communicate with any of the residents in those neighborhoods, whether they be university, college, or just community members in general, that are long-term Boston residents. So for instance, right now, our population of particular concern for us is younger adults in their 20s and 30s. They may be university students, they may be Boston residents. So we really try and focus our outreach efforts and engagement efforts in where the data leads us.
Thank you. If there's any other follow-ups to that, I'll let President Janey ask them in round 2. I just want to note that we've been joined by Councilor Bach. In speaking with her, she'll join the list as it's already been put together. And so I don't know if Councilor Flynn is still present. I believe he had to go. And so Councilor Campbell, the floor is yours if you are here and you would like it.
Yes, thank you, Councilor Arroyo, and of course, thank you to the makers for their work on this critical issue. Obviously, my district does not have universities. Of course, we have students who attend the various universities and continue through various ways to sometimes get some of the complaints around the parties, et cetera, et cetera. So I guess one, and this is maybe through you, Councilor Arroyo, as chair, would be interested in any data that we might have on the number of students that are back on campus, the numbers participating in classes remotely, how many students living on campus or just coming for classes. I'm not sure if that was already received, but would love any information through you as a chair with respect to our universities in that. That's a comment, I guess, not necessarily a question. And then one of the things that I'm just curious about, and maybe this is for the administrative panel, at what point, so we too are hearing the frustration around the parties and the potential of that activity spreading to communities that also do not have, of course, universities situated within them. So at what point does it become sort of red flags or concerning where there's a real discussion possibly with the universities on changing some of the policies with respect to in-person instruction? At what point does it enter sort of the red zone? Just curious from our administrative perspective what that looks like. And then the second piece is, what are the current infection rates for colleges? What are they seeing? What are we seeing? How often is this information communicated? So, and I apologize, I was on early if I missed that in the opening statements. And of course, thank you to everyone for participating in today's hearing.
Thank you so much. And just to the part that might go to the second panel, I hope you kind of memorized that part of it. But for the panel that is present, the administration and Mr. Hanley, if you can answer those questions, please, to the best of your ability.
Thank you.
Thank you.
I can give some data specifically on college versus non-college metrics. So this is, we look at, we have the ability to look at metrics with data, college data, and without college-based testing. So just for the week of September 22 to 28, when college data are included, the average number of daily positivity tests increased by 20.2 per day, with a week-to-week increase from 51.4 positive tests to 71.6. If you excluded college-based testing, the average number of daily positive tests increased from 16.4 per day, with a week-to-week increase to 45.7 positive tests, so 62.1 positive tests per day. Positivity rate week-to-week went from 2.6 to 3.9%. When college data was included. If you excluded it, it went from 3.4% to 4.0%. So not much of a difference there. And then just person level tests change from week to week. If you included college level data, it actually decreased by 6%. And if you included, if you excluded college-based testing, you increased person level tests by 17%. And when we look at that data, I just wanted to clarify that if you test the same person over and over and over again, it doesn't actually pertain to that person level test. So that last data point, that's why you would see a decrease in testing from when college data is included, because they test the same people over and over again versus the excluding college level data. And also, Counselor, just to your point about when do we actually communicate with universities about quote unquote when they're in the red zone. And I think as a city, we are looking at the data on a regular basis and looking at policies and how that will affect a reopening more broadly across the city. Universities, obviously, they're licensed by the state, but we have many interactions with them from housing perspective, from food establishments, etc. There are many layers of interaction with the city, and so whatever policies or plans we implement at the city level will apply directly to the universities as well.
Counselor Campbell, just to give a Harvard-specific answer to your question about testing on campus, I don't have the data in front of me to aggregate all of the research universities who are on the call right now, although I'm sure that every university on the call right now has a dashboard that's updated. In Harvard's case, Harvard has conducted about 16,000 COVID tests over the course of the past 7 days. Over the course of the entire semester so far, if we look at the entire university, Harvard has done about 90,000 tests. Again, jumping back to the last, and across those 90,000 tests, there have been only 9 undergraduates who have tested positive. Jumping back to the last 7 days, Harvard has done 16,000 tests across all of our undergraduate, graduate, and faculty staff and affiliate populations, 16,000 over the past 7 days. And there have been 6 positive cases across those, which gives you a 0.04% positive rate. So it is a small fraction of the overall, if you compare it to the citywide or statewide rates.
No, this is all very helpful, and I'm sure my time has run out. I want to be mindful. Councilor Royo, thank you for running this hearing. So great to keep us all on time. And I'll look out for any data you can provide. And this is helpful because obviously when we get the calls around the large parties, people are absolutely concerned, but wanting to have a greater sense of what the magnitude and the scope of the problem is in terms of infection rate data. So thank you very much. And thank you to all who are participating on the call and the hearing and for the work you do every day. Thank you, Councilor Royo.
Thank you, Councilor Campbell. And I do believe that that second question you asked about the, or maybe it was the first, I don't remember now, but about the data, the administration panel, which is following this, should be able to do a more thorough job on that. And so next we have Councilor Wu.
Good evening, everyone. Thank you so much. I think I just have two questions, one for Mr. Hanley while he is here, and then one for Dr. Lowe. So Mark, welcome back to the council. I'm just curious, you mentioned the dashboard that Harvard has and that it's updated daily. What are the kind of key metrics that drive decision-making at the university off of that dashboard?
Counselor, I have a list of what drives our decision-making. And to the degree that we are now within the fall semester, I would say that we're relying, we're looking at the spring semester and making sure that our thinking is nimble and not static in order that we can make a smart decision for the spring. We laid out some possibilities back in July, but we really have to see what happens with the trend. The key indicators we track on the website, the COVID dashboard for Harvard, which is harvard.edu/coronavirus. I would say that first of all, we give a very easy entry into the number of tests that have happened over the previous 7 days and the number of positives. We group the student affiliate populations in 3 clusters: undergraduate students, graduate students, and faculty, staff, and other affiliates. And that gives you a sense of where we are at Harvard University experiencing positive COVID tests when they do happen. I've mentioned a few times the 9 overall undergraduate tests. There have been, if you scroll down on the dashboard, it breaks down exactly where we've seen those positives. 9, as I've mentioned a few times, among undergrads, 13 overall amongst graduate students, 33 total among faculty, staff, and other affiliates. So that 55 total number of tests is across the 90,000 tests that have taken place at Harvard. All of that information is accessible right on the front page of the dashboard. I think I've walked through the major ways that we organize our data.
Okay, thank you. And I have it up. That's really great. Okay, so I actually thought of another one for you that will be just half a question. Are there any plans or opportunity to share or expand the testing capacity that you have to include sort of neighboring municipalities and the potential for partnerships like we saw with the Red Sox and BPS, for example?
Councilor Wu, I'm not perfectly familiar with the partnership, but I think I get the gist of it. Our testing has been engaged through the Broad Institute of MIT and Harvard. The Broad Institute, I think, is engaged with about over 100 organizations to provide testing, and they are doing our testing with an average turnaround of less than 24 hours. So this is not an in-house capacity that we have for the tests.
Got it.
Although our contact tracing is in-house. And of course, there are other logistical elements, but the Broad Institute is where the bulk of these, where all of these Harvard tests and a massive number of tests overall, if you look at the industry, are taking place on a everyday basis.
Thank you very much. Appreciate that. So Dr. Lowe, could you just in terms of the BPHC equivalent, I know that the dashboard on the Public Health Commission website has the weekly reports that aggregate data by neighborhood over 7-day periods, but do we have anywhere where there's daily updated sort of a running positivity rate that's not just a huge lag and from sort of prior 7-day periods?
We are actually working towards getting up that dashboard now. We have the 7-day, lag for now, but we're actually working towards a day-to-day updates. And we also have our MIC report that goes out on the Medical Intelligence Center report that goes out every day with an update on daily numbers. And that is available for anyone on the MIC distribution list.
Could
And
city council?
anyone can get on that MIC distribution list if you,
Okay.
I can
What's the
provide
best-
that information. I'll provide that information. I'll have Tierney provide that information for you on how to get updated on that list.
Okay, and is there, I mean, could the data that gets emailed out to anyone who signs up just be put on the website as well? I mean, I guess I'm asking because it's just a little nerve-wracking as a parent and thinking about Boston Public Schools where the threshold is 4%, and we're seeing Boston's positivity rate at 3.9% as of, several days ago at this point, and as over a snapshot of sort of a random 7 days rather than just a live, refreshed, updated daily figure, especially when we're that close to what we've decided is a significant cutoff point.
Yeah, as I mentioned, I can definitely get you the information so that you and others, other constituents can receive that information. And as I said, we're working as quickly as possible to share that information on a more digestible format so that it's more accessible.
Okay, and then similarly to what Mark was just saying about showing the data by sort of stakeholder category, especially when we're thinking about ways that the city is using this data to drive decision making. I mean, I just wonder if there's a way to tailor it to really understanding how school communities are being affected, and therefore where more capacity might be needed for testing certain populations by geography or by school community, for example. Have there been any plans around that? And similarly to my previous question, any discussion of partnerships with universities with the wide scale capacity they have for testing to expand that further in the city of Boston?
And we're at time, so on this question, we're then going to go to the next person, but we can do as many rounds on this first panel as we need for my fellow colleagues.
Yeah,
Sounds good,
I
thank
mean,
you.
we have been working very diligently with City Mayor's Office, HHS, and BPHC to be as creative as possible around testing opportunities, including with universities and private partners, community partners. And so it's a process, and we've been working diligently throughout the pandemic just to increase the capacity. So nothing concrete now that I want to share. We're in conversations on a weekly basis, but we are putting that into play. So we're trying to increase capacity in general.
Thank you.
Thank you, Councilor Wu. And so it is now Councilor Mejia, followed by Councilor O'Malley, followed by Councilor Bach. Councilor Mejia, the floor is yours.
Thank you, Chairman Arroyo and the co-sponsors for this hearing. Excited to be here, diving right in. This is for Mark Henley. I'm just curious, can you talk a little bit about the policy towards freshmen, particularly international students? We've seen that they were not allowed on campus due to visa status. And I'm curious to know what barriers put that policy in place. And also, I'm curious to learn how Harvard is accommodating students in regions with poor internet connection.
Councilor Mejia, thank you for asking that question. It gets us back to what seems like a while ago, and it was only some months ago that the Trump administration announced that there would be a drastic, unexpected change to how student visas work that would put highly at risk the immigration status of a lot of students who were learning at Harvard and in the higher ed field all across the United States. Harvard filed a brief along with a number of schools who are represented on this call to fight back against that endeavor of the Trump administration. In less than a week after the announcement came out, it was pulled down by the Trump administration. So that never happened. When it comes to the Harvard decision-making about which of our undergraduate students are welcomed onto campus, there was a long list of criteria that described a student who was not able to successfully learn at home. And among that criteria were students with issues with internet connections. And any Harvard College student who we could not help them figure out that issue has been welcomed back to campus in person in Cambridge. Additionally to that, acknowledging that a lot of students who are in college were not able to work this semester and needed to spend money to get their lives organized and get the right equipment to work successfully from home, there was a financial incentive that was extended to students who receive aid. And I think it was $5,000 per student who receives aid. 1 in 5 students at Harvard College don't pay anything. And there are many Harvard College students who live in Boston who are taking advantage of grants, and some of whom are part of that group of 1 in 5. So we have extended quite a number of benefits to make sure that Harvard College students can learn successfully. And if ultimately that was not possible at home for them, they're back on campus now.
Okay, thank you. And I'm still a little bit confused by the whole situation about F1 status. They were not able to attend in-person classes. Is that true?
Attending in-person classes was one of the crucial issues some months back when that new clarification and the change came down from the federal administration. But that was in large part reversed.
Okay, so I'm gonna stick to my round one. Thank you for that, Mark. I really do appreciate it. My internet is really bad. I feel like I'm in the Dominican Republic right now, but I'm in Boston. So I'm gonna try to get through this. My next question is for Dr. Lowe. I'm just curious when it comes to calling the police on parties. Given a lot of the recent events, some people are uncomfortable calling the police. Are there any other options, or have we begun to think about alternatives? And then I'm also curious about college universities in Boston offering walk-in testing. I saw that BC is not currently offering that service, and I'm curious to get an accurate number. And do colleges and universities in Boston have enough tests to cover the total number of students, faculty, and staff?
I'm sorry, can you clarify the walk-in testing? Can you repeat that question?
So I see that BC is not currently offering walk-in testing where you could just walk in and get tested. And just wondering whether or not we're gonna be able to offer that at BC as well.
I'll have to defer the question about any specific testing capacity to the universities. We have been in conversation separately from university conversations with Broad and the state in terms of their capacity for testing. So at this point in time, Broad does not indicate that they have any limitation to their ability to test on a broad level basis, but again, I have to defer that to a question specifically to Broad. And then with regards to the BPD line, I mean, I think we do have the BPD line. I think that is a conversation. If there are concerns about reaching out to BPD, we can reach out to BPD specifically to see how they're handling calls, and if there are alternatives to reaching out to them. Constituents are always welcome to call 311 and to flag questions or concerns about specific parties.
Okay, thank you. All right, so then my last question, and this is, I'm not sure.
And this will be the final one for this round. But in terms of just to make sure you know the two panels, this panel is the BPDA, Boston Public Health Commission, and Harvard. The second panel, and we're going to go, so everybody will go again for the second panel. That's BC, BU, Northeastern, and I believe that's the three universities we have there, if I forgot one. But BU, BC, and Northeastern will be in the next panel.
Okay, so that was not my time that you just took right there, Arroyo.
No. Your time actually ended back when you were talking to Jennifer Lowe,
Okay.
but I'm going to give you more questions.
Yeah, so my last question is, I'm just curious, this is for the BPDA. I'm just curious because, you know, we have all of these universities occupying space, utilizing the restaurants that residents use, the transportation. I'm just curious in terms of what, if any, additional responsibilities some of the universities are taking up, and if whether or not the city is looking at holding some of our universities a little bit more accountable to the spaces that they're occupying and the businesses that they're using, or at least the students. Just curious about that.
Just to clarify, Councilor Mejia, are you referring to the restaurants and other local businesses located within these hotels?
No, I'm just talking about anything, all spaces, whether it's restaurants, whether it's libraries, whether it's train stations, hospitals, clinics, Dunkin' Donuts. I'm talking about every and any space that folks are utilizing in the city that may put residents at risk. I'm just wondering what is being done in that area to protect residents.
Okay, that's helpful. Thank you. So I think I will again defer to the universities on the specifics of what they're asking the students to do. Across the board, I will say that we have been insisting that several kind of protocols be put in place. One, each university has communicated to their students that there are very specific mask mandates when they're commuting between these off-campus locations and their classes. So that's kind of one very clear and direct thing they've all been asked to do. The second is, as part of the review process and submitting all of these plans for off-campus uses, each university was also required to prescribe sort of a preferred path of commute. So for example, you know, for no other reason, but just to use them as an example, you know, Northeastern has students in the Midtown while sort of commuting down to the campus. They have been asked to sort of stick to Huntington Ave and kind of not meander throughout the Southwest Corridor Park or kind of other areas of the Back Bay neighborhood. So I think these two actions come to mind as being sort of applicable across the board to all of the universities. If there's anything that they're doing over and above that, I think the universities will be able to speak more specifically to that in the next panel.
Thank you for that. I yield the rest of my time, Arroyo.
Thank you. I think that would be negative a minute. So with that, we have Councilor O'Malley and Bach. I just want to let the attendees who are here for public comment to know that I see them, that they're here, that they're not just randomly over there. So if you just wait for the end of this hearing, I'll make sure you have your public comment period. So it's Councilor O'Malley, who may very well be in the DR, judging by that plant. And so I'm gonna let him go now. 5 minutes, Matt. Councilor O'Malley, and then Bach, and then I think Councilor Flaherty is joining us or attempting to join us, and if he does, I'll put him on the end there. Floor is yours, Councilor O'Malley.
Thank you, Mr. Chairman. The balmy winds of West Roxbury have allowed me not to kill this plant behind me on my back porch, so I appreciate it. We should all be so lucky to be in the DR right now, but soon, someday, perhaps. Thank you all to the my colleagues in government and in the neighborhood and City Hall for their great work here. Obviously, this is very, very important. And I wanted to begin really by acknowledging the great work of so many panelists. I know we'll get into the non-Harvard specific university and college questions later, but Jean and Ken and Mark and John Tobin, the second best District 6 City Councilor of all time. It's great to continue to work with all of you. We have been on the phone throughout this pandemic. And I really also wanted to acknowledge the great communication you have among each other, but also with the city and Dr. Lowe, and I know the mayor, and I know his new chief of staff, Catherine Burton, have been really engaged. So I wanted to acknowledge that. I think that obviously the enormity of the challenge of what we are dealing with cannot be underscored, but the fact that everyone is coming together. At the end of the day, many of these colleges and universities are rivals, not only on the ice or not only in the field, but you've all come together to really do what we can to provide safety, not only for your staff and students, obviously, but also sort of the general non-teaching staff as well, who I'm concerned. So I've got questions specifically for some of the universities after. Very briefly, since Mark, we have you in Harvard for this round, but not the next round, if I understand that correctly, right? Yeah.
Correct.
So I would say this is a non-Harvard question, but something that's very near and dear to my heart in my district is the Arnold Arboretum, which is a great partnership between the City of Boston Parks Department and Harvard. Huge kudos to Steve Schneider and Ned Friedman, who've really worked well to encourage usage of the park, one of the most beautiful parts of our city, and have been able to do it safely. So just very briefly, like 1 minute, can you sort of talk about efforts that Harvard has done working with the city? Again, this is somewhat off topic because it's not about colleges and universities per se, but it's about a really important special place that you guys run. So can you talk a little bit about efforts at the Arboretum to keep it open to more people in a safe way?
Yes. Councilor O'Malley, thanks for asking about the Arboretum. The Arboretum is part of Harvard's campus in Boston. The Arboretum is, as you know well, a 281-acre public park. And it is a unique partnership that is like nowhere else in the world, where Harvard University donated all of that land to the city of Boston over 100 years ago, and now leases it back and spends over $10 million a year administering what is not only an incredibly beautiful public park, but what is also an outdoor research museum for woody plants, right? They're open 365 days a year out there at the Arboretum. This is a benefit that's not just extended to every single city resident, but everybody in the world to come to Boston and come to the Arboretum. As you remember, there was some real fear back in April, May, June, especially, that it was not necessarily safe to be outdoors, even with a mask on, even in the sunlight, around other people. And contributing to that fear was the fact that the Arboretum on some days, especially when we had a very warm spring, was seeing 2 and 3 times as many visitors as they do in a typical year. There were some organizational processes that were put in place to encourage bikers to slow down, to encourage everyone to wear a mask absolutely, and to contain crowds at certain events like Lilac Sunday. But I would credit not just Ned Friedman, the director, and Steve Schneider, his amazing operations director, but Mayor Walsh also, and Chief Cook, and Commissioner Ryan Woods, for working together with the Arboretum to agree that although some active parks in the city of Boston, it was appropriate to shut down some elements, right? Basketball courts, playgrounds. The Arboretum, which is a passive park, was never shut. And
So
that was something that Arboretum
we've hit 5
and the
minutes.
mayor very strongly with.
We've hit 5 minutes on that. If you have another question, Matt,
Yeah.
Or if that's it, then we can go on to the next.
Just very briefly, thank you, Mr. Chair. Thank you, Mark. And so Dr. Lowe, I did want to just acknowledge your incredible work here. Have you been the point person specifically for the colleges and universities? I had asked at the earlier working session if we could designate one from BPHC. I assume it may be you, but is there one sort of point person who's been?
Actually, Tom Lane, Tom Lane is the Associate Bureau Director for Infectious Disease, and Julia Gunn is the Communicable Disease Control Division Director. They have both been, Tom consistently, and I believe Julia as well, have both been consistently on the calls, the weekly calls with the universities, has worked very closely with all of the city hall teams to meet up with the universities on a regular basis. So that would be your point person.
Great. No, that's very, very helpful. powerful, and thank you for their great work and all your team. I know how hard this is, but obviously how important it is when folks undercut the severity of what we're up against. It really, it is just dangerous is the only word I can think of. So I will close by saying, in your expert medical opinion, when an individual says, don't be afraid of COVID, how wrong is he?
I am going to say that we should be very concerned about COVID-19, and unfortunately, it disproportionately affects those who don't have the resources to protect themselves. So I think everyone should be concerned, but we should be, as a public health official, I think we need to be concerned about all our community, neighbors, friends, family members.
Could not agree with you more strongly. Thank you very much, Doctor. Thank you, ladies and gentlemen. Thank you, Mr. Chair.
Thank you. And then we have lead sponsor on this, and so that'll change your order in the next round. But Councillor Bach, the floor is yours.
Thank you so much, Mr. Chairman, and thank you all for being here with us. And I do just want to say, I know I was late today, but I had a staffer on the call the whole time, and so I've gotten caught up, I think, thanks to my Chief of Staff, Lauren, for taking very detailed notes. And I should just say, I really appreciate many of the universities on this call have been working with me for months now around, how to make this safe. I obviously had a lot of concerns about students coming back in person, and I would say that I think we're all still, as you're hearing from the counselors on the call, I think we're reflecting the fact that our constituents continue to have concerns, and that, of course, we all know that we're sort of turning towards the winter and less outdoor time and more indoor time. And based on what we know about COVID spread, I think we all have really good reasons not to sort of let down our vigilance. And so that's still where I'm coming from, and where I think most counselors and citizens of Boston are coming from. But I do just want to acknowledge that there's been an enormous amount of testing done by the universities, and that has been a really important tool for being able to nip things in the bud and track where we are here. And I do appreciate that. And I've definitely appreciated with the work that everyone's been doing with me around the sort of Mission Hill and Fenway neighborhoods in particular, where we've got a lot of off-campus students. So I know that the chairman has wanted us to direct our questions to the first panel, so I'll do that. My first question is actually for Dr. Lowe, just related to that extremely large number of tests. I mean, when I was looking at the data, Fenway as a neighborhood has a much lower rate, but then when you look, it has a way higher number of tests. It's up in like the 60, 69 or something thousand. This was for whatever period, and then everyone else is kind of, those neighborhood breakdowns are in the 30s and 40s. And I think it's pretty clear that part of what's playing there is just the number of university students getting tested. And so I wondered, I mean, you spoke a bit about how our data, when we just treat each individual person, that takes out some of the dilution that could be happening here from our universities who are repeatedly testing. But I think I can probably share a lot of counselors' concern that with that repeated testing of folks who are being very closely monitored, that we don't lose sight of of increasing spread in place in our populations that aren't being as closely monitored in the city. So I just wondered if you could just speak to that a little bit more, into how conscious the Health Commission is able to be about the testing sources and kind of those breakdowns to track what might be going on in the non-university communities in the city.
Sure.
Because
So
my concern basically is that if we didn't have all these university tests right now, that our citywide rates would be higher.
So as I mentioned, the data, we do look at testing data, positivity rates, and cases with college data included, without college data included. We also look at those factors by neighborhood. So we are very conscientious about identifying which neighborhoods have higher rates of positivity, have lower numbers of testing rates, higher number of cases. We have engaged multiple partners across the city. I want to credit community health centers and hospitals for ramping up their testing efforts, because we really work with partners like them to ensure that testing is available throughout the city and not just in specific locations. And we're also taking efforts to look at that data so that we have and increase our mobile capacity so that we can actually respond to any changes in positivity, increases in positivity, increases in the number of cases, and decreases in actual testing that is available in any particular neighborhood. So as I mentioned, we do look at it on a regular basis, and we are developing a system that can respond to any changes that we see and be very fluid about that. So.
Sorry, but just a quick clarifying question. In a neighborhood, in an area where we have a lot of students living and getting tested, so in the Fenway neighborhood, do you guys, is there any way that you split the data from, okay, these are the BU tests, and then these are like community members who are going to Fenway Health for a test? Like, is there any disaggregating in that way?
Yes, we look at data. We look at data with university numbers included and separated. At times we can't, depending on the number of tests, we can't necessarily push out information, because if there is a risk of the numbers being low, that we can't share, it's protected health information. But in essence, though, we review those numbers on a regular basis per neighborhood.
Okay, great. And I'm mindful of time, so I'll just say, I know that I've got constituents who are interested in terms of the 311 complaints about parties, and also the calls to the city's tip line. You know, having some kind of an aggregate like report coming back about, like, what are all the addresses? How do we map those? What has the response been like? Just trying to kind of understand what that's looked like. So I don't need an answer on that, but like right now, but just that's an information request I've been getting that I would amplify. And I think I realized my connection's a little unstable, maybe. But if I can just ask Nupur a quick question, if I'm coming through. This is Northeastern related, Nupur, but I know, you know, we've had a long effort in the East Fens to reduce the number of master leases. Obviously, this year we went in the other direction with Northeastern. And I wondered if you could speak to how many. I wasn't totally clear when you guys were doing the planning about how many of Northeastern students were going to end up. I know obviously about the Midtown and the Weston, but sort of exactly how many master lease departments we were going to end up with this year. And I could ask the same thing to John Tobin, but I just wondered if you could speak a little bit to that piece of things, because I do continue to hear kind of concerns in particular from the East Fens.
Sure, Councillor Bach, I'd be happy to speak to that. So the number of master leased buildings that were reviewed as part of this policy were, I think, around 15 or 16. John can speak more specifically to those numbers, or sort of correct me if I'm wrong. The net increase in the number of units that have been master leased by Northeastern is around 120 or 30. Again, John, feel free to correct me if I'm wrong here. It is our understanding through talking with Northeastern during the review process that all of the buildings that are being master leased were already under a sort of majority sort of number of units being leased by Northeastern students. Of the units that were now added to this master lease portfolio, again, a majority of them were sort of already being leased by Northeastern students, although not through Northeastern directly. So as part of this process, sort of what I think conceptually has taken place is a lot of these units that were being occupied by students are now sort of more strongly under the oversight of Northeastern through being incorporated into the official master leases. I definitely hear your concern and just want to emphasize that by no means is this going to be permanent. We've established from the beginning that this is a non-precedent setting policy. And so at the end of COVID, all of the units will be reversed back to their original sort of leasing status. And if at that point, should Northeastern want to include them again into their institutional portfolio, we will go through the standard IMP review process.
Great, thank you. Mr. Chairman, do I have time for one more?
No, but since you didn't do opening statements, I'll allow you the one more if it saves us a second round.
Okay, so yeah, this is for while we have Dr. Lowe, because
we can do a quick second round.
No, I can ask it now. I realize there's a delay on my end.
Yeah, go ahead, shoot your question.
So Dr. Lowe, if you could speak to, there's a lot of concern in the neighborhoods I represent about just us needing more signage, needing more kind of ways to emphasize to students the continuing importance of wearing masks, really to everyone, and I think a worry about both kind of fatigue in terms of following these rules, greater concern as we all move indoors, and then the fact that like perhaps some of the city's messaging and even the university's messaging, and the universities did a lot right at the start, kind of after a while, people just look right past it. So I'm curious whether the Health Commission has been thinking about and has been organizing the universities to think about kind of how you cut through like people just having gotten used to the signs, the messages to a point where they're not taking them on board anymore, and sort of like continue to keep people focused on social distancing, on mask wearing, on all these kinds of things.
I can speak to our communication efforts in general at BPHC. We have been looking at our materials to see how, as we see the demographics shift a little bit within who's becoming positive. So for instance, we mentioned the 20 to 30-year-old group has been increasing, how we can shift our messaging to outreach around that group, to outreach around youth. And also with increased rates in previously in East Boston, we looked at shifts in terms of culturally competent and appropriate messaging around that. So we as an entity have been very, again, we've used the data to really understand how we need to change our focus and our messaging. I'll reiterate that in the past, the universities and colleges have taken a very strong role and very helpful role in really taking the lead on how to message to their population. I would defer to them to speak of specifics about how they're going to pivot as necessary, but in the past they have taken ownership and been quite successful in messaging to their populations.
You're muted.
Okay. Sorry, it was a quick follow-up. Just as that, does BPHC have any centralized place for students citizens who want to find out information about the schools that are not the Big Four? Like I'm thinking about Fisher, Emerson, Suffolk, folks who are not here. I know that I've had some people feel like it's hard to get the information on what the testing protocols and stuff are for some of the smaller guys.
I will have to get back to you on how to specifically find that information, but I can share that once I find it.
Great, thank you so much. Thank you, Mr. Chairman. Thank you for your indulgence.
Thank you. And so now I'm going to take my time. I'm trying to make this very quick. I certainly won't go over the time constraints that I've asked for other folks. If anybody has any questions for this first panel, still raise your blue hand and I will go to the order of blue hands. If you have any questions for the Boston Public Health Commission, the BPDA, or Harvard. Otherwise, when I am done, you are all free to leave and go about your day. And so we'll start now. Dr. Lowe, two questions for you specifically. One, with the party line, has that been sent out over the COVID text message system? Have we sent out the information for that party line to everybody who signed up for the COVID text? Has that happened?
You know what, I will have to check on that. I can find out that information easily for you.
Probably should if it hasn't.
Great.
So that's one. And then two, I know that our numbers have obviously been rising. Attributed to that, I think it's something like 35% between, college age. It's like 35, 40% between college aged areas. Do we know how much of that, the clusters, but also how much of that increase is due to our undergraduate populations? Is that traceable? Are we able to identify that?
So we do, again, we are in constant communication with our universities. They are providing information, and in our own data reporting system, we do have a way to mark if they're specifically affiliated with a university or college cluster. So we are tracking on that, and if it is marked, I will say a number of those cases in our own system, we can see in the 20s and 30s that are not necessarily affiliated with universities. So we do have a way, if it's documented in our system, to monitor that.
Thank you. And then Mr. Hanley, my question for you in regards to testing, not just students, but I know there was testing in place or testing plan in place for essentially affiliates, folks who are working within Harvard but aren't necessarily Harvard personnel directly. What's the status on that? Is that ongoing? Is that something that we can mark or measure on the COVID dashboard that you have?
Councilor Arroyo, I think the quick answer is yes to your question. I think that probably the Harvard affiliate or staff member that you're describing is captured on the website. There are some contracted employees who, because of the individual relationship, might not be captured in our testing. But what I can tell you definitively is that anybody, even a contract worker who is on Harvard's campus for 4 or more hours per week, is being asked to be tested for sure. So that testing is extended to folks who might not be Harvard employees. Although again, our faculty, staff, and other affiliates metric, I think, would probably capture the type of person you're referring to.
Thank you. And just one follow-up on that. I know that when we had you here in July, you had mentioned that students would be tested every 3 days if they were living on campus. Is that held true? Is that basically what is happening?
Sometimes more than that.
Okay.
Every 3 days is the standard for students living on campus, undergraduate students living on campus.
Thank you. And I just want to thank, I don't see any hands for a second round. So I just want to thank everybody for their patience in the second round. And I also want to thank everybody for their time in the first round, especially Mr. Hanley. I know you had a hard stop at 5:30, so I apologize for whatever happened after that. So thank you for being here with us at 6:18. I appreciate you. And so now with the second panel, we'll be going into and you're released. So if you don't want to be here anymore, you can head out if you're in the first panel. And I can't imagine you would want to be here anymore. And so we have John Tobin, Vice President of City and Community Affairs at Northeastern, Ken Ryan, the Director of City Relations, Government and Community Affairs at Boston University. We have Thomas Keaty Jr., the Vice President of Governmental and Community Affairs at Boston College, and Jean Levesque, the Director of Government Relations at Boston College, and also some affiliates who are here from those universities specifically to answer questions. Here's a question for the group at the moment. I am online, obviously. Councilor Braden, Councilor Janey, Councilor Bach, all of our lead sponsors are here. Councilor Mejia and Councilor O'Malley are here. We may be joined by a councilor who left later, but that leaves us with essentially 6 councilors to ask questions. So this should go relatively rapidly. We are actually on schedule at 6:20. My goal was to end around 6:50. My hope is we can still end around 6:50. I recognize you've all been here though since 4:30-ish. Do people feel like they would like to jump right into it, or do we want a 5-minute break so folks can use the bathroom or do whatever they have to do and then come back in exactly 5 minutes? What's the vote there on? And I'll just do thumbs up if you want to just keep going, jump right into it. I see 1 thumbs up, 2 thumbs up, 3 thumbs up, 4. All right, I'm just gonna call it. We're just gonna go ahead and do that. And so with that, the floor is Councilor Braden, followed by Councilor Janey, followed by Councilor Bach, followed by Councilor Mejia, followed by Councilor O'Malley. And on this one specifically, because there's 3 universities here, we're just gonna go as nobody. So if I have to call time because it's 5 or 6 minutes, but you still got questions, don't worry, we're gonna get them out. We'll do as many rounds as you need to feel like you got what you needed. And so with that, Councilor Braden, you can take the floor.
Thank you, Councillor Arroyo. I really appreciate all of you being here to be able to talk through these questions that we have. It's a complex and constantly changing environment, so I appreciate that. In terms of the off-campus housing, I really welcome and I'm very grateful for BC for agreeing to move their off-campus students who test positive into housing on campus so that they can be securely monitored and provided with food, etc., and not living with roommates who tested not negative. That's a really big step forward, and we really appreciate that. One ongoing question is that seems to come up with my constituents is the issue around team sports. I know that there was a video, and this is directed at BC. There was a video about after the Texas game last week of the team celebrating all together in a large room. No, not a mask in sight. I know, and people were really concerned that sends the wrong message to the rest of the student body about what is appropriate behavior. And it also seems that you're asking part of your student body to live like in a much more restricted way, and yet your team players are allowed to do that have that sort of experience. So it seems to be like a mixed message. Could you speak to that, please?
Yes, Counselor. You're absolutely correct. It was inappropriate behavior that should never have happened. And the head coach of the Boston College football program apologized publicly for that behavior. A message was sent to the athletic director and to the head coach. And that, I can assure you, will never happen again under these circumstances. It was a moment in time because Boston College came back to win the game. It was a great football game. Unfortunately, no one was in the stadium, and the excitement, I think, overcame them. And they were in their locker room when that video was taken. And so the people responsible have been reprimanded for that, and the coach took full responsibility for that, and we apologize publicly.
Yeah, but you understand though that it sends a really weird mixed message to. I appreciate that they apologize, but
it did.
It sends a mixed message, and as we know from watching the Patriots this week, just because even professional footballers aren't immune from getting infected, even if they're tested every day. So I'd hope that those footballers are being monitored very closely to see if they actually did spread any COVID in that context.
Yes, they are, and they have tested negative. They're tested 4 times a week, twice by the Atlantic Coastal Conference, which is their league that they're in, and twice by Boston College. And we've had only 1 positive test, and that occurred when the team came back onto campus in late June. So we're fortunate not to have any further football players or personnel. There's a total of approximately 158 members that comprise of the football team. That's from coaches, team managers, trainers, and players, So we have approximately 158 that are considered part of the team.
Thank you. Just another quick question, and I'm sorry, I'm focusing a lot on BC. The off-campus party situation, how's that going?
I've been here 20 years, and this is the first year. Usually you have parties that Thursday, Friday, and Saturday nights. And this is, we've had 2 gatherings, one on Wade Street and one on Radnor Road, which had, the one on Wade Street had 23 people and gathering, and the Radnor Road, I want to say, had approximately 15. Both of those houses have been called into student affairs and have been dealt with. We have suspended from housing approximately, that have come before our judiciary committee, 56 have been suspended from housing and 4 have been suspended from the university. And that's for the fall.
Okay, thank you.
Okay.
So we're at
Mr.
5
Ryan.
minutes. We're at 5 minutes.
Is that my time?
So
I'm very conscious of the time, and I will let some other folks go ahead. Thank you.
are you? But we got you for a second round if you have BU Northeastern questions. Thank you, President Janey.
Thank you, Mr. Chair. Thank you. And most of my questions, I'm sure all of my questions are geared toward Northeastern. How are you, Mr. Tobin and team? I'd be really interested, and this could be for any panelist, but specifically for Northeastern, I'm interested in lessons from the fall semester, how we might apply them to spring. I would like to get, and I know you covered some of this in your opening, but if you could just recap the testing protocols, and I'd be interested in specifics of where we are in terms of if there are any cases and what's happening there at Northeastern. I'm also interested on the theme of athletics for students who are attending any of, again, this is for any university, but in any of your campuses on a scholarship, an athletic scholarship, and cannot play because of COVID. Are they in risk of losing their scholarship? Has any student lost a scholarship? What is happening? Is this going to impact incoming students if we're worried that this will be extended throughout 2021 in terms of who is coming into your campuses?
Thank you, Madam President, for the questions. I will take the second one first and then hand it off to David Luzzi, who heads up our testing. With regards to athletic scholarships, even though we're not allowed, we made the decision not to play, or our league decided not to make to play in fall sports. That does not mean that student athletes lose their scholarships. In fact, even though they're not allowed to play, they are still allowed to train in certain ways, in distance ways. We have our D1 athletic, our D1 teams actually train the outdoor teams.
Well, that's good to know. I just want to make sure that they're not
train outside of
risking.
Boston. They train at a field in Dedham and a field in Brookline. And I'll hand it off to David Luzzi on the
Testing protocols, and then where we are in terms of your dashboard and reporting out. Those are the kind of 2 questions I have.
Yes, sure. Thank you for the question, President Janey, and thank you, John. So if I could actually do that in flip order, let me do a little bit on the history. So we imported between 25 and 30. I can get you that exact number. Of course, it's always hard at the late stages of move-in to know whether those last few cases were imported, but we can check and get that final data. But we imported between 25 and 30 of our circa 80 student cases that we've had so far in the first move-in period of the semester. And then if we look at our dashboard, we see that we took that down to 0 to 1 new cases for a period of time. That tells us that our very aggressive testing of students immediately as they arrived on campus and then 2 days later, and then 2 days after that. So days 1, 3, and 5, and then isolating every student that of course tested positive, worked in terms of completely containing that because a number of young people, of course, are asymptomatic. So they didn't know they had COVID. They traveled with COVID, arrived on campus. But we were successful in bringing that down to 0 and getting everything completely under control, a few days after move-in ended. So, so that's important in 2 regards. One, we know that our testing and isolation protocols worked. That's clear data that it worked. The second thing is that a big chunk of our total student cases is that first kind of pig in the snake there that came in during move-in. So as we look at the cumulative number of cases, I think we have to consider that as important information. So since then, we've been stable and under control. We're testing students every 3 days. That's the protocol. Compliance has been very high, as well as compliance with masks and social distancing, et cetera. We have a student tip line where they can report any issues they see, and that has been active and we've been responsive to that. So we're very confident that we have things under control and are confident as we move forward to the spring that that is true. Now, as we go into the spring, we're also testing systems like, for example, we have a research group that's already proven that they can see COVID, SARS-CoV-2, that is the virus that causes COVID, in wastewater at the Deer Island treatment plant for Boston. They've now shown that they can do that in separate buildings. They have implemented that in Somerville, and that of course was just in the news a week or so ago about the effort that Northeastern researchers have done with the city of Somerville to get early detection of potential outbreaks of the virus. So we, as we implement those things, we will be going into the spring semester with, I think, an even more robust scenario than we have right now. So this is more tools, more arrows in our quiver. So we're pretty confident going into the spring that we have a good system in place. Of course, how good the flu vaccine is a very interesting wild card. But we are on top of that, looking at flu testing as well as flu vaccination, and we will, be incorporating that into our posture in how we run the campus going into the spring.
Mr. Chair, how am I doing on time? I have one final question.
That hit exactly 5 minutes, but you can ask the question.
Oh, thank you, Mr. Chair. So I'm wondering, in terms of parties and gatherings, it sounds like you guys have some good strict protocols in place for on campus or the big hotels where things might be happening, but in neighborhoods where students are living kind of in an apartment here and then an apartment there, how are you monitoring? Talk to me about how you're getting at the off-campus parties and behavior that is unsafe in terms of public health, but also annoying in terms of quality of life for residents. Thank you, Mr. Chair, for your indulgence.
Thank you, Madam President. This is an issue off campus that quite literally keeps us up at night. We made it when the President Owen decided to bring Northeastern students back. We understand that there was a great deal of conversation, perhaps consternation amongst neighbors and community partners about that. And we knew that if we were going to do this, we had to do it right. We had to be diligent, and that included not just on campus, but off campus as well. Our students who live in the Fenway and Mission Hill and Roxbury and South End. So in addition to the BPD, Boston Police Department patrol that's on Mission Hill in Roxbury on Thursdays, Fridays, and Saturday nights, which is now a mandatory overtime shift that has a university representative. Sometimes it's Northeastern, sometimes it's Wentworth, sometimes it's the College of Pharmacy, because those officers can't go to houses on their own. They have to be with BPD. In addition, we have civilians from our office and city and community engagement who are on regular patrol, walking patrol, and driving around in our cars all the time through Mission Hill, the Fenway, in Roxbury until those police overtime cars take over at 11:45 p.m. till 3:45 a.m. There's the tip line that was established of Northeastern. That tip line we monitor, our office monitors for 20 hours of the day. And then any tips that come into that tip line go into the Boston Police Cruiser, into the university representative. And it doesn't matter where the kid is from. Sometimes when we get a call, we don't know if it's a Northeastern student living there or any other school that's living there, but we respond and take names and trying to adjudicate matters. We've been, I think most students have been adhering to the practices, modeling the practices they learn on campus, off campus, because they don't want to go home either. They want to be here and finish out the semester. And those issues, we're constantly working with our community partners and just being a constant presence out there, rewarding good behavior. By the same token, when it warrants it, reporting those incidents and calling in Boston Police when we have to. But more importantly, bringing students in to student affairs. And also, if it's a student from another university that we find to be out of compliance or a large gathering that's coming about, we share that information. It's very important that all the colleges and universities are sharing that information with each other. And we've been doing that. And we're not taking a victory parade by any means. But we also want to make sure that people use that tip line and that community neighborhood groups that want Zoom calls like this, so we can talk about our protocols and anything they may be seeing or hearing that we're not aware of, we need to know about it. So by all means, if we've done a number of neighborhood associations in groups, and we're happy to continue doing those.
Thank you.
Thank you.
And if anybody needs a second round again, we'll do as many as it takes. Councillor Bach, if you have questions for this panel.
Yes, thank you, Mr. Chair. I think I'll start with questions for BU, just to, be fair here. So I guess the first one, Ken, is just if you could speak a little bit to, I've gotten some community questions about, I think in BU parlance, they're category 4 students. So students who are living off campus, they're not going to campus, they're not in university housing. And I guess at least on the neighborhood side, there's a perception that if you're in that category, you don't have to be tested under the same protocols as somebody who's in university housing or is going onto campus for some of the Learn From Anywhere classes. So just wondering if you could speak to how many people are in that category, where they live, to what extent they are getting tested, just because it's a very specific BU question I've been getting.
Thank you very much for the question, Counselor. I don't necessarily have that particular figure in front of me, but I do have Dr. Waters with us here this evening that might be able to give a little bit more information about that testing category in particular, or how our testing protocol works when it comes to those folks.
Yep. So certainly students can be in different categories. For the most part, it's faculty and staff who would be in category 4. We would have very few students who actually live in the Boston area that would be in category 4. So any student who comes to campus regularly is going to be tested. So they will be, so the protocol is that for our undergraduate students, they're tested twice a week, whether they live on campus or off campus. And our graduate students are also tested once a week, whether they live on campus or off campus. So there should be very few students. Anybody who would be in category 4 is not allowed on campus to participate in any activities. They're not a part of the campus community.
Okay, thanks. That's helpful. I'd love if there is a number to know what it is, but that's great to know. And could you speak a little bit, Ken, to, this is really a repetition of the question I think Councillor Wu asked Mark on Harvard's behalf, but obviously BU has stood up internal testing capacity, and I know there is this question about, as we, especially if sort of our COVID rates rise community-wide, what's the university's capacity to help with testing the broader community in addition to the BU one? I know you haven't made any commitments on that front yet, but I would love to understand what capacity there might be there. And then maybe to tag on to that, a question about what portion of your tests in general have been kind of about vendors and contract staff.
Yeah. Thank you again for the question, Counselor. I know, early into the semester, obviously our focus has been number one on our community. I know that keeping our community safe, tested, is what's going to be the best benefit that we could have for the city at this time. When it comes to the testing of those affiliate workers that you're talking about, we do in fact test those folks, and they are built into our numbers. I'm looking at Dr. Waters, who will be able to give a better answer than I, but anything you might be able to add to that, Dr.?
Yep, so we have about 25,000 individuals who are in our testing protocol every week, and we do at least 30 to 35,000 tests a week. Of that, about 20,000 is our students, about 2,000 are faculty, 4,000 are staff, and we have about 500 what we call affiliates. So those would be people who work in food services or the bookstore, or those kinds of things, who are not actually BU staff, but who we've entered into our testing protocol to be sure that they're also tested, and they're tested frequently once a week.
Great, thanks. And Mr. Chairman, am I out of time, or do I have one more?
You're out of time, but since we're down and everybody else has gotten one more, you can get one more.
Okay. Well, I should just say, I guess I similarly wanted to ask John that question about vendors. Is he here still? I don't see him on the screen.
Yeah, I'm here.
Oh yeah, I do. Sorry, John, you're right in the middle of my screen. And I should say that Mr. Tobin has been on frequent Zoom calls with me. He referenced these, and they've been really important, I think, to our Fenway and Mission Hill neighborhoods. So I won't get into the details that we talk about there, but I would like to understand from the more kind of workers side of things, what proportion of Northeastern's testing is that, and how inclusive you've been able to be of vendors and community members.
All right, I'll Council, I think the first part of your question was a compliment, but you were breaking up a little bit, so that's regretful. But the second part about the testing for workers, I'm going to hand that back off to my colleague, David Luzzi.
Yes, sorry, I was on mute. Most people like me that way. So yes, we do test our vendors, through our protocols, and they are tested twice a week, as are our faculty and staff. That is the protocol at Northeastern. Did I miss something, John?
I don't think so. Council, has answered it?
Just what proportion of these tests, when we look at your numbers, how much of it should we understand to be vendors, staff versus students?
Yeah, I can get you those exact numbers, but the vendors is the smallest of the three components. Kathy, do you have those numbers?
Yeah, it's just under 1,000. And it includes dining services. We have a cleaning contractor. We have security folks, bookstore, et cetera. It's just under 1,000 that get tested twice a week.
Great, thank you so much. Thank you, Mr. Chairman.
Thank you. Gideon decided to make an appearance earlier. It sounded like he destroyed a person when I was giving Councilor Bach extra time, but he's quite lovely. Councilor Mejia, the floor is yours. It's 5 minutes, but really it's whatever you want at this point. So just take as much time as you need.
I know, and it's getting late, so we're all competing with who has the cutest dog of them all, right, Arroyo? All right, so you did win. Let's keep this moving. I'm just curious, this is for Ken. Can you talk a little bit about how you're monitoring students, their mental health during this time, and what resources are in place? And this could be for anyone. I'm just really curious about the mental and social and emotional well-being of students who are carrying, some who are taking this really serious and others who may not so much, and kind of like the level of frustration. I'm just curious about how we're dealing with that.
Thank you very much for the question, Councilor Mejia. There's probably no better person to answer that question than our Dean of Students, who was kind enough to join us tonight. So I'll kick it over to Dean Elmore.
Thanks, and I appreciate the question. It's an important one. We are doubling down on a number of the programs that we have been doing to make sure that we are able to give people both individual counseling as they need it, but also the group counseling is important too. We've beefed up the way, so there's this other important piece. Our clubs, our organizations, the ability for people to engage in recreational activity, all safely, but all of those things we've had to beef up a bit and make sure that we've got it there and that everything's not on these Zoom calls for people. They actually need the physical contact. And we've been able to do a lot more of that through, both our fitness and recreation spaces, letting people exercise, letting people take walks, supervising those sorts of things, and supervising small, very small activity with people in clubs and organizations. We also have both group mental health counseling, but also individual as well. Very important. And we are looking at, we also have to look at ways too that we can give students private spaces for counseling sessions too. You don't want to do this in your room with your roommate as well. You want to have some space where you can do that, or maybe even to have some space where you just got to go and talk to someone one-on-one. Could be a family member, could be a friend from afar, and you don't want to do that in your room. So all these things are the sorts of things that we are trying to make sure that we do. We're trying to keep them outside as much as possible and trying to keep them as active as possible, but also letting them be able to buckle down a little bit on their work. Connections with their families are still very, very important. And it's constantly, we're constantly trying to make sure that we've got some good quality mentoring conversations. One of the things that we've started is a mentoring program or mentoring conversations with our first year students. We want to try and make sure they all get a good, solid conversation with a so-called adult, a staff member or a faculty member here. These folks have gone through some incredible transitions and they're still working through some of those transitions. So I do appreciate the question. It's an important one and it's one we just got to stay up on. So thank you.
Yeah, and I appreciate you being prepared to answer it. That was good. Thank you for that.
And if I could add one other thing too, we know too that we've got to look at mental health in a lot of different ways. And now, the cultural aspects of mental health are very, very important. We're seeing some things that we haven't seen before. Obviously, with the the Black Lives Movement and sort of a healing justice movement, you got to take different approaches with that. And sometimes these are ways that you've got to pull people together. We're also seeing, for example, some aspects of our students or some segments of our students who usually never took us up on counseling and mentoring, who are now coming forth for that. And they're doing it collectively in communities as well. So that's been a really good development, and the more we can see, the better. So thank you.
Thank you for that. And in the interest of keeping the conversation going, I'm going to go now to Tom. If you could just tell me, or anyone, I'm just curious about the protocols that are in place for faculty and staff who test positive. I'm particularly interested thinking about the dining staff, the custodial who are part-time. Does this mean that they will lose their pay if they're not able to work? My mom is a food handler, not at any of your institutions, but she does work on a college campus. And, that's definitely a concern. And I'm just curious about how your universities are handling that. Anyone can answer that.
I can. Okay. I'm sorry. I can address that, Counselor. Thank you for the question. And just as a quick follow-up on student mental health, it is a very important question, and BC also has launched a program through, it's called Alone Together, through our counseling services that actually provides Zoom-based programs and workshops for students, particularly those who want to either see a counselor or in a group setting, particularly for students who might be in some of the other populations, LGBTQ here on campus. So it's been very popular, and it was also raised on our all call with the Thursday calls about making sure that we're addressing both physical health but mental health as well. So I just wanted to add that. As far as the testing protocols for Boston College, we started with the baseline test for everyone that was planning to be on campus here in the fall. We started with testing 18,000 people coming in. We also test on a weekly basis any types of high impact areas of the university, such as BC dining, those in particular police, RAs, folks who are coming into contact with students. We have a symptomatic testing program as well as asymptomatic. All BC faculty and staff are required to fill out a symptom check. It's a downloaded application to your tablet or your phone every day. Check off if you have symptoms. That goes directly for students to University Health Services, where they are followed up immediately with that and scheduled for testing. Getting back to your question about walk-in testing, we obviously have the health center where students can go. The health center's been divided into a COVID and non-COVID side. So we're also seeing, students on a regular basis on the non-COVID side. For the asymptomatic testing, that is done at the Margot Canal Recreation Center, and it's done from 8 to 3. You'll receive an email.
Yeah, no, I just want to make sure that you got my question, and I'm sorry, I don't mean to cut you off, but I'm just really curious about staff, particularly custodians, part-time staff, low-wage workers who happen to work on campus. If they do test positive, I'm curious about their ability to lose pay if they're unable to work. I'm just curious about that in particular.
I could get back to you. I don't know the answer, but I at this point, they would come in, they're tested once a week. I don't think that they would lose pay. They would quarantine or isolate at their home. And I would check into that, but I'd still be on staff and being paid.
Okay, well, because I know that some low wage workers, depending on what type of union representation, if any, they will not be covered. If they have to quarantine for 2 weeks, that's 2 weeks without pay. And because of a lot of our low wage workers who are working in institutions don't have the disposable income to just sit at home for 2 weeks quarantining, I'm just curious about what that looks like. So I just want to put that out into the universe.
No, I appreciate the question, and I will follow up with clarification on that, whether they are paid during the time that they're quarantining or not.
Thank you.
Thank you, Councilor Mejia. So now it is my turn, and then we'll go into a second round. This question's for every university. Specifically, I asked this in July, and my hope is, at the time, it sounded like this was still kind of a work in progress. So my hope is we got some more firm answers here. But one of the things I was concerned about is in my own college experience, I knew that my peers who took work study or took on the responsibility of being a resident advisor, some of them did it because they wanted to do that. Most of them did it because they needed to do that. Being a resident advisor obviously gave them benefits for staying on campus at a cheaper rate. As a work study, it gave them income that was used for a number of different things. And in my experience, it was used for books. Obviously, with COVID and with the way in which we're kind of locking folks down and how that's impacting that, what solutions have your individual universities come up with to ensure that a student who is really dependent on being a resident advisor to pay for their housing or having a work study to pay for their materials, what aid are we getting beyond just you can apply for financial aid? What specific thing are we doing for those specific members of the community?
I can jump in a little bit here for us. A piece of this is to make sure they can keep working. I mean, that's an important piece, that they can be a resident assistant. And, one of the things that we've got to look at too is to remind ourselves that although they're working, they're still students, and we got to make sure they can still be students and do the sorts of things that we need students to do, like get their work done and not to be in fear of their work as well. So our resident assistants, for example, are working. We tried our best to make sure we could preserve as many work study positions as possible and also job prospects that students have, sometimes converting online, because we still have some students who are taking classes in other places, but still need to work and still need to get paid. And so they've got online positions as well. And then, we've had to think about ways that we've got to convert some of the positions that we have. So for example, let's say we've got some students who work at an arena or work in some space where they're ushering. Well, we're not necessarily doing those programs now, but we decided let's take some of those students and see if we can give them positions around campus, helping with social spacing, social distancing, and some other sorts of things that are more like what they were used to, but in a different format. So we've repurposed jobs for students. We've tried to make sure students have jobs. And we also want to make sure that they're students too. And that's an important piece. And from the financial aid front, we've been really good about trying to make sure that things like scholarships and other pieces of their financial aid stay relatively intact. We also know that students' life circumstances may have changed, and our financial aid options allow people to go and ask for additional aid to see if they can be aided. I think those are the big things. And I would also say too, one of the things I know that I do is I try to do some fundraising to make sure that we have discretionary dollars available to help out a student who may need something because of a change in lifestyle circumstance, or maybe that job doesn't necessarily materialize. You got to help them with their computer when it goes out. You got to help them get a hotspot if they need that. And, that all goes to it all. And if that student didn't have a job or didn't have that income that they relied on, you got to be ready to help them. And we've got some mechanism to help out there.
Thank you for that. If anybody else wants to engage with that question before I head to the next one. No. Okay. One of the other questions I have is we just saw with the White House that we certainly need redundancies in place. In other words, if you're doing the testing, that's great, but the testing alone will not save us. We're going to need masks. We're going to need social distancing. We're going to need all of those kind of built-in redundancies to ensure that this spread doesn't happen. And I think the White House exhibits kind of what happens when you take out the redundancies because you believe that just getting tested is going to do it. And so my question for that is kind of multiple folds. One is, I think you've all done, at least from the looks of it, a great job with the testing. So that's not easy to do. And so kudos to all of you for that. But in terms of the social distancing and the off-site parties, which I understand are kind of a part of college that we all expect, but one that in this atmosphere is certainly very dangerous. When we're looking at instances where whether it's BU is security or Harvard security, who's not here, or Northeastern security or BC security getting involved in these instances, are they monitoring, are they enforcing these kinds of regulations, the mask regulations, the social distancing regulations? And when we're looking at the individual, and I think you can correct me if I'm wrong, but I believe every university still here, Northeastern, BU and BC, has had to discipline or send home students for not following regulations. I believe everybody's done that. In the instances in which that is happening and looking towards the spring, when you may be bringing back more students, what are the lessons that you're learning here and the difficulty it is to contain this in terms of making sure people follow these regulations and how you can maybe enforce that in a different way, but also in terms of policing this, because I'm sensitive to this from two areas. One is, these are 19, 18, 20-year-old kids. I call them kids even though I'm 32. And there's a reality towards, where they're processing in just in general, all the science and data on how they process decisions and risks and all of those different things. It's why we talk about juvenile sentencing to adult sentencing. When we talk about sending them home and having these really stringent consequences on them, I understand it 100% from the risk that they've exposed the university to and the risk that they've exposed our communities to, but there's also sort of a lack of restorativeness to that. And so my question on this specifically is, when you are essentially doing those kinds of punishments, which I understand there's probably a push and pull on this, right? If we ask like 13 different counselors, some of them might say send them home immediately. The reality is, for me, I recognize that they're essentially put into this position of wanting to live a college experience. They have these kind of data examples that we know that they're not going to be making these kinds of decisions very well, which makes it essentially your jobs to put them in a position to succeed in this environment. When they fail, which they are, I mean, we've had several from every university at this point. We've had multiple parties. The party line exists for a reason. They are failing at this, maybe not in large numbers, but individually. What is the restorative justice plan for this? How are we making sure that when you send a child home, there's some kind of totality of the circumstances being taken into place here? I know that in some cases, kids are getting sort of probation, some kids are getting sent home. There's a number of different things that are happening. So there's obviously some kind of mechanism that some of you are using for the severity that sends you home. But I would love to know from each university, when you're dealing with these students and these individuals and these essentially these young adults that are forming, you're trying to create lifelong learners, but you're also trying to create adults. What are the methods that you're using specifically to deal with this? And in what way are you taking into account what kind of situations these kids are coming from individually, what kinds of situations these kids are being exposed to at home, or if they go back or off campus, what kinds of risk they have? Because the reality is, I told every university that was here, one of my major issues with this is that we know that students don't understand risk analysis. We know that car insurance knows that. And so the question is, you know that, what is happening to ensure that these kids aren't just getting sent home and then, we have these 60 kids from DC that are now gone. We have no idea what that means for them and their ability to complete their studies in the future, or BU or Northeastern. What is the totality of the circumstances analysis that you're applying here?
I'll jump in. I'll jump in, Chair. It's important to note, I mean, some of us, all of us were 18, 19, 20 years old at one point, some more recently than others. And it's important to note, even though they are that age, you think about college freshmen and they lost their graduations, they lost their proms, they kind of lost their last summer of being, a kid essentially. And they're in a hurry to get things going and want to come back to, to school. I'm just speaking for Northeastern. All of our freshmen and sophomores are required to live on campus. That's always been, even pre-COVID, that's been a rule. That doesn't mean they don't go out and try and seek out off-campus behaviors that are detrimental to the community and to themselves. And they also had an opportunity to do the hybrid program, to do the NU Flex program. So when they came in, these are our kids and we love them, and they're our students. But by the same token, we also, when we try to go to stand up the university, to be reopened, we also made a pledge to our neighbors and to the city that we were going to do the right thing. And when kids weren't in compliance, we were going to judge that on a case-by-case basis. So it's important that, and I think the most effective part of all this, as we're learning, is not just us as adults telling the kids what to do. It's really using that peer-to-peer relationship and conversations. Kids are going to listen to other kids much more. Hey, I'm a junior here. You're a freshman. Don't mess this up for us. We want to stay here. We want to complete out the semester and come back again next semester. So that's a very important part of the conversation. But I think when it comes to, to compliance and, into bringing kids before student affairs, I think I know it's definitely on a case-by-case basis.
That's good to hear.
Counselor, I think you did a little bit of answering some questions for yourself, right? I think you laid it right out. This is about being firm for sure, but it's about being fair. And I think that what you're asking, and I think it's important here, is that we employ a bit of compassion here, and that we have to, as John just said, we've got to look at each case on its own merits. We got to give that student a chance to tell us a little bit about what happened, but what's more, who they are and what's going on. And you're right, you do have to take into consideration of the totality of this person's life, this young person's life. And that's why they're here. They're here to learn and everything else. But you also got to be firm about this too. And you got to make sure that the lessons learned are the right lessons, and that you can give a little. Mercy and compassion are pretty important right now. But here's the thing, though. This COVID's got an urgency that's really important to consider too. And you don't get as many chances. And you got to make sure that when you're talking to that student, that you give them a sense as to maybe the fact that they have very little room for slippage in some of their cases. And in others, maybe what they did gives you a tiny bit more space. But we deal a lot, and I'm the person who's got to see this. Once a week, I sit down and we are going through all the responses we need to make to students for a variety of different reasons. Maybe they were reported for not wearing their mask. Maybe there were 6 to 8 of them who were just trying to have a little excitement for themselves and they just didn't distance the way that they needed to. And we try to look at each individual and each individual circumstance, but we also try to say to these young folk too, I'm a person who says, you are a young person, but you're an adult and you need to act like an adult and you got to grow up real fast right now. And we will do our best to try and help you as best as possible. But if you do it more than once, but if you do it in some severe circumstance, I may not be able to help you the way that you need that help. And so you've got to think this through a bit. I will say that we can affirm that we give every individual student a look at their circumstance, a chance to tell their side of the story, and where we can, and we've done this, we've said, let's talk a little bit about how you can make people feel more confident, feel more better about you being around, given what you just did. And I think that's restorative a bit right there. I'm not sure I'm ready for the community doing the restorative because I think right now everybody's out for a head. Everybody's got very little patience with this sort of stuff. And so, I think it's incumbent upon people like me to try and advocate for everybody in this situation, including the student who might have offended a little bit. I said earlier, we got to make sure they can be students, and that's an important piece. It takes a lot of work. It takes a lot of time. I feel like I do about 80% of my work on COVID right now, but it's really important to keep these kids in school. There's so many students out there who've said, hey, look, you don't have to worry about me. I'm worried about this other person who's going to get me sent home, and I work too hard to be here. I work too hard to get where I'm at. I put too many resources in this. I'm not going to let them do that. And by the way, Dean, you don't have to worry about me being the one who's going to get me shut down and sent home because I don't want to do that. Love my family, but I'm not trying to do that. I'm here from a social standpoint to advance in my life, and I need to get this done. And I need to get it done in person because there's a very different quality and standard of being here in person than getting this degree online, especially for a young person, and especially for a young first generation student or a young immigrant student. This in-person experience and getting a chance is really important. And so they know how to do that. The other thing I worry about too is that we sometimes focus on one kind of social experience as being problematic. And any kind of social experience in COVID is really important to make sure that you're doing it right. So, I think that focusing in on a type of experience in the Alston-Brighton area or the Fenway area, it's one type. There are lots of ways, and people come from so many walks of life where they socialize. And I don't want them to think that because it's not a humongous party with 25 people raucousing in the street is not as problematic as being in close quarters with 4 other people without mask on either, just sharing a little wine and music. That could be problematic too. So we got to make sure these messages get out to everybody and all of our students. And also this notion that we got to be firm about this. We got to be on top of this and serious about it, but we got to be fair about it. The other piece too is we're planning to do a push. Everyone's fatigued, but we got to do a push in about a week or so to remind people about some of the social messages, physical distancing messages, the mask wearing, and also the small but distant group and social connections that are important too.
All right, so I appreciate that. Thank you for that. There was a lot there. And so I'm certainly at time.
You asked a lot.
Yeah, I did. I put a lot out there, and I appreciate the thorough answer because the reality is my concern is these are still children. And so the way that, as a society, we are coming down real hard on them for doing things that frankly are what most people consider part of a college experience they just can't experience right now, right? And I think there's a valid reason for that, but I also want to make sure that we're being fair to those students as we're going through these processes and that they're just not being made examples of in a way that is going to cause them immense harm and less benefit for our communities, frankly. And so with that, I had another question. I'm sure it'll come back to me. We do have a second round coming. We're going to try and keep this shorter. I believe Councilor Bach had questions for round 2. I don't know if any other counselor has questions for round 2, but now is the time to speak now. And then I guess you can speak after Kenzie Bach. Councilor Bach goes, because then at that point you can just say I'm good. But Councilor Bach, the floor is yours for your round 2 questions.
Great, thank you, Mr. Chairman. And I'm going to try speaking from my phone because I know I've had a delay. Is that better?
That is better.
Great, excellent. So I guess my quick question is, it's following up on something somebody asked, but basically from all three of your institutions, kind of what's your plan for, we've just been talking about the need for a 4-season city, for kind of like thinking about how to create space for people to gather outside in the colder months. And just because of how much safer we know outdoors is versus indoors for that kind of gathering. And certainly I know that in the neighborhoods I represent, we've seen lots of students taking advantage of the opportunity to gather outdoors. And so I would be concerned about, that them wanting to gather in small groups in the same way that they do now and not having outdoors be as much of an option. So I'm wondering what the universities are planning to do about that proactively. And then while you're answering that, if you could just confirm in each of your cases kind of what the approach is towards Thanksgiving, return from Thanksgiving or not, and kind of how late into the winter the students are expected to be on campus, when they're leaving and when they're coming back, just so we can have a sense of what portion of those colder months. Like I know I have a sense of the BU case, but less of a clear sense from Northeastern and BC about the calendaring. So if you could just speak to that a little bit, that'd be great.
Counselor, this is Tom Keaty from Boston College. The university is going to have a decision on Thanksgiving at the end of the week, but we are planning to, for the winter spring semester, come back the weekend after Martin Luther King weekend, which I believe is January 19th. But internally, we're going back and forth about Thanksgiving right now. And the decision should come down by Friday.
Same here, Councilor, with regard to messages, same as our spring communication, which we've set in place, but we haven't alerted the students yet. So we want our students to know about this. There'll be a communication coming up in the coming days regarding Thanksgiving to our student population. With regards to outdoor gathering spaces, I'll hand that off to Kathy Spiegelman.
Yeah, so we have put up 7 tents around our campus, and our intention right now is the tents, the sides are up and the students are able to use them for eating and for studying. And our plan is to be able to use them with sides down when it gets cold. We're looking at putting furniture in lots of the public spaces that are not being as well used because of the social distancing and rearrangement that we've done in many of the buildings on campus. And we're also looking at heaters, outdoor heaters. We're working with the city on what the permitting and the safety issues are around that. But the idea is to try and help our students have opportunities both outside and inside, understanding what's going to happen when it comes to be winter, where they can safely be, social distance, but with each other, and certainly in terms of spreading them out for dining, which is one of the ways that we know they can still have joy while we're trying to limit the number of parties and other kinds of social activities. So that as far as Thanksgiving goes, we're like was mentioned for BC, we're about to issue specific information to our students, but our intention is to discourage, if they're going to go home, we're going to discourage them from having to come back. If they do come back, we'll expect them to test and have 2 negative tests before they could participate in campus activities, including going to classes. And since our semester ends less than 2 weeks from when the Thanksgiving holiday ends, there won't be much incentive for students to go and come back, and all of the finals will be online. So we're just, if they want to stay, and then they'll keep with the testing protocol of every 3 days. But if they go home, we're we're going to put a message out to them to sort of discourage them from traveling and then coming back.
And we're very much in line with a lot of what everyone said too, including Thanksgiving. We're going to try and make it seem very onerous for you to leave and come back. You will have to travel quarantine, and it's only 9 days left when you get back.
Yeah.
And likewise, we're looking at a lot of the similar kinds of things that are about extending the outdoors. One thing I will say is that pretty soon, and especially once November starts to hit, their academics tends to discipline them. We tend to see it about mid-October, certainly right into early November. These professors come out swinging, and so they tend to take a lot of that time, and especially where the social on the Thursday, Friday, Saturday nowadays has been severely limited, and there are not as many places available, they're doing their work. And so the academics will discipline them a little bit in terms of using, in terms of coming together as well. But we do worry about that too.
Great. Well, thank you all. And I would be remiss not to say, as a crossover from another hearing, and seeing Councilor Mejia reminded me of it, that we are looking for places to help our restaurants and small providers store stuff over the winter in between this December 1st deadline for outdoor eating, and then March, when we hope it'll start back up. So if any of you, I know that each of you are concerned about and thinking about your local business ecosystems, which we know are suffering a lot. And so I just wanted to flag that to the extent that you have facilities that are really in abeyance this year because of the nature of how everything's shaking out, and might have space to support that local ecosystem, and also to the extent that you're ordering heaters in any kind of bulk and wanted to help out, I think we've got a bunch of smaller proprietors who can't get them. So that's me shamelessly crossing over into another area on this, but I felt like while you guys were here, it's worth saying because it's something that we're definitely worrying about a lot on the council side. Mr. Chairman, I think those are all my questions. I'm mindful of the hour, so I just want to thank everyone again so much for joining us, and for all the continued communication offline, separate from these hearings.
Thank you so much. And I know we have 5 attendees in the public chat section waiting to give public comment, and so I appreciate very much so your being here for this long. I see you have your hand up, Councilor Mejia. So the floor is yours for the second round of questioning, and then I believe we can, after your questioning, if anybody wants to give a closing, you can. I'll give a brief closing, and then we can go straight to our public comment.
Thank you. Yes, thank you. And I won't take up too much of your time because we have people waiting for testimony. I am just curious, but first of all, thank you all for staying so long and for sharing all of the amazing work that you're doing to keep our residents safe. Really do appreciate your efforts. And as Councilor Bach mentioned, I was going to ask you all, because I always do, just to give a little bit more. I know that we have some restaurants that need some help, but then I'm also thinking about students in the Boston Public Schools who have very limited access to the internet. And we're thinking about digital divide and equity. And I'm just curious what, if any, opportunities exist for Northeastern, BU, and other big time institutions to be able to be a good partner and to help support some of our most vulnerable learners right now who are experiencing connectivity issues because of the digital divide is real. And so just gonna plug that as something else for you all to think about in ways that you might be able to support residents. Particularly, we have over close to 3,000 students in the city of Boston that right now are unable to connect. And so whatever you all can do on that front, it is COVID related because this is COVID situation here and they're doing remote learning. So this is a COVID conversation. And yeah, that's it. I just wanted to put that out there. And I really do appreciate, Kenneth, your thorough response in terms of the mental health. I think that that's an issue that a lot of students are carrying. And so I'm glad to see and hear that you all are on the forefront and doing some work around that. That's really important. So thank you for that and all that good stuff. I'm not gonna hold anyone else hostage, but I just wanted to just throw it out there. And thank you all for your time.
Thank you so much. President Janey, I'm not sure if you want to close with anything. If so, the floor is yours.
Thank you. Just briefly wanted to thank everyone here. Thank you, Mr. Chair, for chairing this very productive and thoughtful conversation. Wanted to thank the panelists and certainly my colleagues and co-sponsors, Councillor Bach and Councillor Braden. I don't want to talk. I want to really hear from the public so that we can wrap up. I do hope, though, that we will continue the conversation moving on, particularly as we go into the winter months. Thank you.
Thank you so much. And I'm going to close here too by thanking all of you for being here for this time and all of the patience that you've exhibited to our attendees that I'm about to give public comment to. And the one thing that I would say is, I'll join my colleagues in saying that there's a lot of need both on a local front, but also even in BPS as we talk about educating our own children, whether that's the digital divide or how we're going to be handling our facilities. And I hope moving forward, there's ways in which we can partner, whether it's use of resources like testing or things of that nature with our facilities and our groups into the ecosystems that you've already created. So thank you for your time. With that, I'm going to go to our public comment period. There are 5 people here. I expect that every single one of you would like to give public comment. And so if you can just raise your little blue hand, but we're going to start with Lori Rodwin, who will go first. There is just name, association, affiliation, or neighborhood, and then you can jump right into your 2 minutes of testimony, and I'll be keeping time on that, and I'll just let you know. So just please do put the blue hand up so that I know that if you are here, it is because you want to speak. I expect that it is, but I'm not going to just go to somebody and see. So if you have the blue hand up or you're on my list, you will get hit. So Lori, can you hear me?
Yes, I can. Can you hear me?
Yes.
Great. Thank you so much for allowing my testimony today.
Thank you.
I'm very, yeah, you're welcome. So I'm a doctorally prepared nurse who studies quality of healthcare and healthcare equity. And I review for the Journal of Healthcare for the poor and underserved. I'm doing an international study right now on COVID and stress. And so naturally I turned to the scientific literature to better understand in-person classes, the responsibilities of the colleges to the community. And there's not a lot of research because the whole thing is pretty new, but I'm very interested in focusing on what the college itself can do to discourage community spread while discouraging student partying. So here are 3 things to consider. First, at baseline, the science says that the spread of COVID to surrounding communities increases when college students return to campus for in-person classes. So there's an increase in the community when there's in-person return. And the investigators concluded that colleges with in-person teaching were associated with more than 3,000 additional US COVID cases per day. That's 3,000 COVID cases per day when there was in-person teaching. And this was per day, so it doesn't even account for the exponential spread. Number 2, what to do about this? So researchers studied phased reopenings. And once the college had assured that students weren't bringing COVID to campus, there were models generated about how to phase reopenings. And the best model is as follows. One group of students comes to campus at the start of term. The next group of students comes no earlier than 1 month after start of term. And the next group comes no earlier than 2 months after the start of term. So it really is a phasing that allows for almost the first month to be a pilot test of how well the interventions are working, how well, what needs to be tweaked. Maybe you go remote, but this model of 1 month phasing in once students don't bring the COVID to campus was found to reduce the peak number of daily campus cases meaningfully as compared with everybody arriving around the same couple of weeks. 3, thorough assessment of on-campus and community factors should be done before reopening in-person classes in order to prevent spread to the community or mitigate it. So there's a very good article. All of the research that I'm citing is embedded in my public written testimony. So there are a lot of factors to assess and plan in terms of anticipating vulnerabilities when college campuses reopen. So one factor that I'll talk to in a minute is the vulnerability of all the communities that the counselors have been talking about: Fenway, Roxbury, Mission Hill, and so on. So looking at this science, I do have some perspectives to share. Considering what we know about community spread when there's in-person classes, colleges should report transparently their COVID data, and it should include the number of new infections, the number of total infections, the transmission rate, and most importantly, the correlations between campus and community cases. That correlation number is going to be important because if it's positive and, high, it says something about what the in-person teaching at that college is doing to the local community. Considering the sciences, colleges should be strongly urged to phase reopenings. I listened to a lot about coming back for the spring semester. There's science that supports a certain kind of phasing in. And if a college isn't going to do that, I think they should explain the rationale why they're not doing it. And finances is not, in my opinion, a sufficient rationale. The third point that I made in the science was thorough assessments should be done with interventions identified when vulnerabilities exist. So I listened to the whole July hearing, and I heard about givebacks like refrigerators and housing for Pine Street workers. I heard some of those things today. They're all great, but they're not interventions to stop community spread. And so the communities that suffer, we know, are experiencing high healthcare inequities. And the colleges should be doing something to help the health of that community. A couple of examples: they could be offering free testing. They could be having on-campus community clinics for people with chronic disease who are even more vulnerable, or they could limit the number of returning students. And my last point as a Boston resident, I would like to know how many public health dollars are being spent to deal with COVID on campus. I want to know how many public police dollars are being used in these interventions that the colleges have described, because I think that's an important consideration for where our scarce dollars go. And thank you for taking my testimony.
Thank you, Laurel. And I can't wish you any good luck with the Lakers, but I do think it's big in the finals.
I'm from LA, what can I say? Thank you for having my testimony.
No problem. Next, Jade Tan from the ACLU, a public health advisor at the ACLU. Can you hear me, Jade? You're unmuted.
I can. Thank you.
All right, perfect. We can hear you loud and clear. So you can go ahead. The floor is yours.
Thank you and good evening. My name is Jade Tan. I'm the public health advisor in the Tech for Liberty program at the ACLU of Massachusetts. I submit this public comment to provide some civil liberties and civil rights related information on behalf of the ACLU and our 10,000 plus members and supporters in Boston. Some colleges and universities are attempting to resume in-person education using technology to control the COVID-19 virus spread, from remote fever detection technology to apps that track symptoms or help with exposure notification. Administrators may view technology as a cheap, easy to deploy tool to use during this crisis. Here in Boston, universities and colleges are not only using apps to try to control the spread of coronavirus, but are also resorting to social media surveillance in attempt to control student behavior. We are concerned that the invasive use of technology in this way is both ineffective and harms student and employee privacy. Using tools like social media surveillance to track student behavior could have the unintended consequence of making students less likely to honestly disclose their behavior to university health workers and put the community at greater risk of uncontrolled virus transmission. Trust is central to public health, and surveillance and invasions of privacy undermine trust. In the interest of privacy, the following considerations should be taken into account when deciding whether and how to use apps. 1, what does the app try to do? Does it administer daily health surveys, remind students and employees to get tested, or provide daily exposure notifications? Does it connect to testing or treatment regimes? Will it help students and employees get in touch with campus health services or tell them where to get tested? Does it record their movements? The ACLU is skeptical of location tracking and proximity tracking as anti-coronavirus measures and oppose the use of the former in all circumstances. 2, is the app used as an enforcement device? Any apps used to ensure compliance and quarantines or social distancing rules dramatically raise the stakes around their accuracy and dependability. 3, what data does the app collect? Does it require students and employees to identify themselves, or can it be run anonymously? Does it collect health information? If so, does the collection of that data align with current public health advice? Does it collect location data or associational data? How frequently does it collect any such information? Number 4, are data stored centrally or only on the devices used by employees and students? Data stored in the cloud or on university servers raise many more privacy issues than data stored locally on phones. 5, who has access to the data collected by the apps? A company, school administrators, campus or town police, others? If used as an enforcement measure, who is notified of suspected social distancing violations? Administrators, academic deans, campus police. 6, is it voluntary? Are students and employees given a choice about whether to use it? Are there places on campus they can't go or classes they can't take without the app? 7, what policies govern the app and the data it produces? Have administrators communicated with students and employees about its security or privacy protections? Are those protections strong? 8, how much control do students and faculty have over the app? If use is not voluntary, can they turn location tracking off, pause it, etc.? Or is it the functional equivalent of an ankle bracelet? 9, what servers does the app talk to? Some apps are built with third-party software development kits known as SDKs that are unnecessarily intrusive, show advertisements, or consume the students' and employees' battery or data plan. And lastly, 10, is the source code for the app available? Have students or faculty at the university had the opportunity to review that code to verify that the app operates as advertised? And if not, why not? Students and employees should ask these questions of any school administration that is using an app to try to control the spread of the coronavirus. These efforts may be made in good faith, but could have a negative impact if privacy is harmed, thereby reducing trust in public health efforts overall. Please do not hesitate to contact us if you need further assistance with the issues discussed in this public comment. Thank you very much, Councilor Arroyo.
Thank you. And we have one final public comment signed up earlier. Martin, I don't know how to pronounce exactly the last name, so please do correct me if I'm wrong here, but is it Roeder? Martin Roeder?
That'll do. It's been pronounced much more adversely than you've done it, so that's okay. It's a German name, although I have a British accent.
So just for me, so I know how to pronounce it, because I think names are important. What is your full name?
I would say Rutter.
Retter?
Yes.
All right, I tried. So we're here. You got as much time as you need here, 2 to 3 minutes, however long it takes you.
Okay,
It doesn't count.
So I live at 144 Beacon Street in the Back Bay. Until a few weeks ago, I was chair of the Neighborhood Association of the Back Bay, and did in fact get involved in conversations with some of the universities about their college reopening plans, because naturally our community, which is, shall we say, slightly older than average, is very concerned and was and is very concerned about the relationships between colleges and members of the community. I have a number of observations to make, and then maybe some questions that can perhaps be addressed at some point in the future. The first is that it seems to me that this is going to be a long-term issue. I've certainly had confirmed by the discussions that it's not as if somehow miraculously in the spring semester and maybe even a year from now, we will be out of the woods. The reality is that whatever happens in Boston is subject to, how shall I put it, the lowest common denominator, what is going on throughout the United States. And the lowest common denominator, as we know, is extremely low indeed. We're fortunate, I think, in Boston in that as far as I can tell, most of the adults in positions of authority seem to be responsible and knowledgeable, but that is clearly not the case in many other parts of the country. And of course, students, amongst others, who come to the Boston area come from all places in this nation, and therefore are subject, when they go home, to the worst of what can happen. And I won't go into any details. I think you know who and what I'm talking about. One thing that would interest me is I would like to get a sense of how students and faculty and staff in the universities themselves feel about what has been going on over the last few months, whether they're encouraged, whether they're depressed, what they like, or what they don't like. And I say that, you know, having recognized that there are a lot of people in these colleges and universities, and indeed members of the City Council itself, that have been doing the best that they can to cope with this pandemic without, shall we say, any real help from the federal government, which seems unable to institute even the most minimal of national programs and policies that are widely accepted. I have listened to what the ACLU has said and their concerns about private.
Last one.
And if you watch the movie The Social Dilemma on Netflix, you'll be aware that this is a very general concern. One issue that I've come across is there's been concern expressed that some of the this is not necessarily tracheal nas, but some of the reporting of what goes on that universities would like to avoid, like the holding of parties, may involve students reporting and other students, which obviously creates a problem for them and possibly also a threat, because nobody likes to be called a snitch. And how do you balance the need to protect your health and the health of other people against the desire not to inform on your fellow students in ways in which might lead them to be punished? I am, I must say, appalled at the notion that Boston College is pursuing football. I mean, football, I mean, talk about a contact sport, you know, very large people smashing into each other, some of whom are nowhere near the ball, does not seem to me to be a sensible way of making sure that you minimize the spread of coronavirus. So all in all, what I would like to see, and the final point I'll make is the one that's been raised by several people about the digital divide. We've talked about what universities and colleges can do, but I would draw your attention to the private sector. The major huge suppliers of broadband access, Verizon, Comcast, AT&T, and so forth, have, I think, fallen down lamentably in their responsibility to try and make sure that broadband access is made available to everybody in the United States at an affordable cost and acceptable levels of performance. And this should be now regarded as something that is essential to full participation in modern life, only one layer above in terms of urgency than access to healthcare and food and shelter and water and so forth. So I would hope that in future discussions, we don't simply talk about universities and colleges and communities and the city, but we also get other parts of the private sector involved that should be playing a much more significant role in coping with coronavirus. After all, the future success of these companies depends upon a steady flow of well-educated, knowledgeable people, which after all is one of the major contributions that colleges and universities make to this country and indeed to the world. So thank you very much again for allowing me to shoot my mouth off to a certain extent, but I really appreciate all the inputs that have been made and the efforts that the City Council and the City Councilors continue to make in this field. And I hope that they continue to have an influence upon the mayor and the governor and others in positions of authority to take decisions and make choices that will help us all get through this together. Because if there's ever a situation in which we can only get through it together, it is this one. Thank you very much.
Thank you so much. I appreciate that. And that was our final public comment. And so with that, I'm just going to say thank you again. I noticed that the Northeastern Boston University have stayed on for public comment. So I appreciate that. I just want to make sure I reference that, as well as my fellow counselors.
Counselor, Boston College is still there.
I see BC. There you go. You had the camera.
They're still here.
Yeah.
Okay.
Yeah.
So BUBC.
But we're saying goodnight right now.
And we responded to your.
Thank you. Thank you so much for making sure that was clear. So BUBC and Northeastern stuck around for public comment, which always means quite a bit for me, because as panelists, you're really here for the panel, but when you stay to listen to the public, that matters. So thank you for that. I want to thank our counselors who were here for the entire hearing. Counselor Bach, Counselor Janey, President Janey, Counselor Braden, and Counselor Mejia. And I want to thank folks who stayed on to give public comment. It was incredibly important to hear from you, so thank you so much. And with that, I'm going to adjourn this meeting. There's a little button that you've probably been looking at that says leave. It's red. And you can go ahead and hit that now and head out.
Thank you, everyone. Thank you.
Thank you, Mr. Chairman.
Thank you.
And thank you,
all.
Central staff.
Thank you.
Have a good evening. Thank you.
Thank you, bye.